and head of the University Clinical of Gynecology of Faculty of Medicine and Health Science, Olszewski University, right? Okay, and the other blah, blah, blah things is too much things. So, welcome to Professor Rudy. You can introduce me?
Yeah. So, my co-chairman is Liang Jing. Let's have a look at what she has done in her life. I think this cannot be all true because she's too young, huh? You cannot do so many things and be so young, huh? Yes. So, important is that she's not only very qualified and experienced, but she's also open-minded. Open-minded for something that is already there, but not known by everybody and not used by everybody. And I think this is why we are sitting here. We are sitting here to learn about experience from the others. And people like Liang Jing are here to convince everybody here that there is a future that we should take into our consideration when we are taking care of patients. And talking about patients, what is the most important thing in patients? It's not our expertise, because this is clear that we have to be expert taking care of patients. It's not only thinking about the disease. No, it's thinking about the patient. What is the problem for the patient? What is the disease that makes the problem for the patient? And it can be that, like in ovarian carcinoma, we are doing extreme surgery to save the life of the patient. But at the end, if we are dealing with diseases where we see that surgery is perhaps not bringing the solution, we should think about alternative therapies. Alternative therapies that, at the end, save problems for the patients. And following Zhibiao's message, harm less. Try to take care of a disease without harming too much. And this is why I'm very happy that we can announce and introduce Professor Zhibiao Wang, who is working, I think, all his life already on alternative therapies where all the others were taking care of major surgery, later minimal access surgery, and perhaps right now even less than minimal access surgery. But I don't want to hold the lecture of Zhibiao. He will, in his normal way, very clear and very strong, he will explain why HIFU is a method that we should think about taking care of our patients. Professor Zhibiao Wang, please.
Ladies and gentlemen, thank you. Thank you, Professor Rudy. So our old friends here joining with each other once again. As mentioned by Rudy, as doctors, we have to think what the patients need the most. What we can offer is to minimum health, minimum harm. This is a big topic. Now I'd like to talk about this doctor. He published an article in New England in 2003. He's a surgeon, and he was very proud that a lot of procedures were created by him. However, he published a comparison study last year for the early stage prostate cancer. There are 3 groups. The first one is active monitoring without any interventions, and the second is the prostatectomy group, and the third is the radiotherapy. For 15 years of follow-up, there's no statistic differences of mortality. So he asked a 50-year-old man, he has an expectancy life of 30 years. If you use the prostatectomy or radiotherapy, there will be irreversible effects. How he can spend the other 30 years. So that's the question to the surgeon. Traditional surgeon using the open surgeries, even robotic surgeries. So Fred is a great doctor. No matter how advanced he has technologies or techniques, he put the needs at the center of his treatment. So on the May 27th, Friday will come to Chongqing. We will talk about the minimally and non-invasive surgeries. He also thinking about the surgery development. Surgery is developed by Westerners. However, this word should be redefined. In before, surgery talks about results. It's about open cut, put people down. However, there should be a new version. Less is more. And that should be the new version. The less is more. So that's something we should redefine surgery. This is a new thinking. We should bring more benefits to people and less harm. So that gives rise to the focused ultrasound ablation surgery. This is not a philosophy own wholly to China or to the world. It is open to doctors around the world. It is the same as doctors do to minimize the harm. And it can do that. We can have this focused ultrasound, and it was very targeted. The other tissues around the target will not be harmed. This is the technology. What we should do to promote this technology, to unleash the benefits, we should learn this technology better to avoid the harms it may cause. There's no best solution. There's only suitable solution. Is HIFU non-invasive? HIFU is only a technology. It's not just the definition for non-invasive. We can compare the knife, blade tip, blade handle, hilt, and for the HIFU knife, there are three also components. And for the blade handle, it's ultrasound, non-invasible. And you can see the blade tip, it's the focus of the power energy. An instant second, the lesion can be treated. The hilt is also visible. Altogether, we can see it's an invisible knife. So from outside body to treat lesion inside body, to see things inside body is very important. In the past 20 or 30 years, so we have technologies such as the grayscale showcase and the MRI temperature map. They have their own advantages, these two methods. However, in treating tumors, or in treating brain tumor, the MRI monitoring is also great due to this great man. Coverall Hallinan is the founder of the MRI guidance for monitoring, and he lays out the foundation. As a doctor, practicing, and as a scientist, you can see there's an editorial, and this editorial says, we should establish long-term safety and efficacy and cost-effective treatment devices that are not reliant on online MRI guidance must be developed for broader accessibility. Real-time monitoring should be fast, should be working with the blade tip. there are some insufficiency for MRI mapping. However, ultrasound lags behind the MRI in imaging, especially the contrast of MRI of ultrasound cannot be compared with MRI. So today, we are going to talk about the past, present, and future of focused ultrasound. I think we have to mention the very basic concept. We put ultrasound together, target the ultrasound is not a sonic target. Well, it's actually the biological target. So when the sound or sonic applied to the biological body, the body will react. That's the tip of the blade. It's not the sound itself. Some people never think about it before. So the tip I want to mention, the tip is actually the lesion of the biological body. It's the biological focused region. It's not acoustic focused region. They are related to each other. So they are the intensity, time, the structure, function. There are over 20 varieties. So we have to understand the true tip is the biological focused lesion. Therefore, the real-time response is very important. And for ultrasound, we can see the grayscale, and for MRI, we can see the temperature. They have their own advantages. We're marrying the merits of the two methods and put them together for next year and the year of the next. And the ultrasound can monitor the temperature in the near future, and especially the real-time temperature on the targeted area. So this is my own prediction. In 1 or 2 or 3 years is quite predictable. If temperature can be monitored for ultrasound, it can be really real-time monitoring. But anyway, we should pay tribute to MRI because of the temperature monitoring. So I saw equipment from Vincent. It's about the Parkinson's treatment to treat lesion inside the brain. The focused ultrasound is not property to any company. It's a property to all human beings. So the travelers, 2 hands are traveling. We asked the patient, which one do you want to treat? A left hand or right hand? The patient said he wants to treat the right hand. After this 48 seconds of irradiation of the focused ultrasound, the hand will not travel, and the left hand is still traveling and shaking. So we also did this with the help of MRI monitoring. It's still quite useful. After 48 seconds of irradiation, the hands didn't shake. I believe it is the results that we cannot imagine brought by science. 48 seconds solve it all. However, there are some difficulties. 48 seconds of irradiation, but the whole surgery process took 3 hours. The time it took is about the targeting, adjusting, and doing the calculations. So we have to talk about the future development. We never deny the use of MRI. What we are thinking about is the future prospects. So by sharing these slides is about the biological focused lesion. is actually the blade tip. On that basis, we invent the HIFU blade. So from 1999, 25 years have passed. The National Museum of China had collected the original equipment of us. This first equipment was retired. It was very old, and you can see the picture. It is collected in the National Museum of China as an exhibit and a milestone of history. So please, everyone, GC300 or GC400, we have this technology, the infusion of imaging. So there are some problems in the ultrasound temperature monitoring. So in the in-deep body, the MRI is very great, better than ultrasound. So it takes 3 hours of treatment time. Why? MRI does not respond immediately compared with ultrasound. So for monitoring, we actually align the MRI and ultrasound. So this requires practice, response, debugging, adjustments. So after several rounds of this, we will improve this technology to make it simpler and more efficient. I think the alignment process may be difficult or challenging for you, but I believe in the near future we will make it easier to use. We have to feedback to our engineers, hardware engineers. We should improve this, and doctors, please use this equipment so that we can have feedback. So this dynamic alignment accurate rate is only 20 to 30%. For example, when we treat the patients, when the breast or the uterus moves, we can track the movement. The accurate rate is not high enough, but after 1 year or 2 years, we believe the accuracy can be increased to 80 or 90%. So please use this, help us improve. Our dream, we hope. This is the result, the ablation. Okay, the membrane is protected, the outer layer is great, and there is no single open cut. Well, I've been talking about this picture for 10 years. Every time I talk about it, I'm excited. For open cut surgeries or laparoscopic, there are holes. We think it's reasonable, legal, all right. However, we do not have any other way. But if there's technology, there's no cut. We can use HIFU blade, only some high temperature lesion. That is only the adverse effect for HIFU. If there's a lesion caused on the skin, but for open cut surgeries, the holes are normal and reasonable. That's not right. Well, these are some patients and cases. After our treatment, the women can conceive again. There are a lot of HIFU babies. I hope to see more. It's not about the technology, it's about the concept. Well, you can also work with hysterolaparoscopic surgeries combined with the HIFU. And Rudy may talk about the adenomyosis treatment. So it's my first time to hear the speech from Rudy. You are a surgeon. You do very well the laparoscopic surgeries. What you are challenging? You are challenging yourself, Rudy. So he can actually use this technology to treat patients. The technology is enough. However, Professor Ruby talks about what benefits can he bring to patients. Even he is a so experienced expert, I admire him. While we both challenge ourselves for the patients, that's the cause we pursue. I admire the spirit. Well, there's another doctor, Selva. Speaking of the fertility, well, the birth rate in some developed countries are slowing down. How about those who cannot conceive? Well, Dr. Savaraja treat patients to help them conceive, have babies. What's more admiring is that he promotes his concepts and techniques to more and more people. For example, in 2022, he had a training course during COVID-19. It was very difficult. However, Dr. Savaraja managed to make it. We look forward to see more HIFU babies. That's about the future population development. So sitting here is also include doctors in breast specialty. Rudy said that we have to listen to the patient. This is artist Mahkota. She had breast cancer. She had mastectomy. After she wake up, she said that she's not a complete woman, so she took this picture and published this in 1991 on the front page of Times. Well, challenging the doctors whether the breast can be saved. So to this century, our doctors champion the breast-saving surgeries, and uterus-saving surgeries is also prevailing now. HIFU is a solution. For example, the breast cancer before and after treatment, and this is the combined therapy, and we can also treat breast fibroadenoma very fast. This is a collaboration of the whole world. This technique belongs to the whole humanity. For example, Professor Ava Kwang and Professor Michael Duke, they had a seminar in Nanjing, spending 5 days in China, Nanjing. They explored how the focused ultrasound can be used to save the breast. On that day, there were 20 or 30,000 audience doctors. It was really a scene. So many people. I was very attentive. We save organs. We minimize the harm. That's the original aspiration as doctors. We are seeing that we are going back to the original aspiration when we became doctors. So the picture of artist Mahkota will be realized. The guidance for application were published in 2005, the very first one. Dr. Selva. So to preserve the facility, we should have the guidance as well. And this is also an expert consensus on these techniques. Now we have 5G. We can do remote surgery. So Dr. Sun Yonghua did it very great. So doctor had this remote surgery and surgical room, operating room. So and this is the distance over 1,000. The doctor was in Chongqing and the patient was 1,000 kilometers away in Inner Mongolia. The procedure was done before. patients and doctor are in the same operating room. However, with 5G, we believe the whole Earth should be a mega surgery room, operating room. So the whole way of surgery will be revolutionized. This is the result of technological revolution and the needs for human well-being. There are two societies. The ISGE, the International Society of Minimally Invasive and Virtual Surgery. Next year we will have the 6th international event in Chongqing. We welcome you to join us in Chongqing next year. And the next will be the future prospects, the all-in-one diagnostics and treatment.
先进微创手术，再到微无创聚焦超声纤溶手术的发展过程，对患者的损伤越来越小。聚焦超声纤溶手术是从体外发射超声波，聚焦于体内的肿瘤组织，在焦点区域产生。
What this video shows the mechanism of the focused ultrasound.
对焦点区域以外的组织无损伤。颠覆性的全新治疗方式，在21世纪已经产生。今天，经过20多年的积淀，基于大数据的聚焦超声纤溶手术，结合最新影像科学技术，已经进入一个智能化的数字诊疗新时代。数字解剖可以立体展示患者的局部解剖结构，大大提高诊断的准确性和治疗的安全性。数字病理可以使我们对许多病做出快速准确的病理诊断，避免传统冲刺病理带来的损伤和副作用。数字诊疗让治疗变得更简单、更安全。从诊断到治疗，让患者获益最大，器官得到最大限度的保护，诊疗将变得前所未有的轻松。这一代正在到来。
现在数字化病理。
So this is a digitalized solution. Pathology. 卞修武 Academician is leading the team to do the digital therapeutics. So this is also a result already with an accuracy of 78%, 87%. That will be all. Thank you.
Thanks for Professor Wang's speech. As we know, Professor Wang is a founder of HIFU, and she created a miracle that only seen in Kung Fu story before. Now, because of time limited, the Q&A section is the end. Let's start for the next section. And thanks, Professor Wang, again.
Thank you.
Okay, let's invite the other 3 chairs of the next part. Professor Wang Liqun, Professor Li Fang, and Professor Liu Chang.
嗯，好的。那下面一场呢，由我们3位来主持哈。我首先介绍一下这个李芳教授。李芳教授呢是这个山西省晋城市人民医院妇产科中心主任医师、医学博士， 重庆医科大学博士后。
And she is a director of Obstetrics and Gynecology Center, Cheung People's Hospital. And I would like to introduce to you Professor Liu Cheung. He is Administrative Director of the Department of Obstetrics and Gynecology, First Hospital of Lanzhou University, Doctor of Medicine, Chief Physician, Professor, Doctor Tutor. And you can see other titles of him on the screen. I will introduce to you Professor Wang Liqun. She is Director of Department of Gynecology, Professor, Doctoral Supervisor of Jiangxi Maternal and Child Health Hospital. She is also Visiting Scholar of Florida State Hospital. Now I invite Professor Wang to introduce to us the next speaker, who is Professor Yang Wei. He is Professor and Chief Physician at the Department of Oncology, Chinese PLA General Hospital, and he is also a Director of Tumor Minimally Invasive Treatment Ward, 5th Medical Center. He won many awards too. Welcome, Professor Wang. Thank you for your introduction. Good afternoon, everybody. Today, I will talk about the clinical application and development of focused ultrasound application technology in line gynecologic diseases. And actually in our hospital we studied this kind of therapy in 1995 in the conference. There are 3 parts. Actually ablation technology developed very fast over the past 20 years, and it is also called the energy therapy, and different from the traditional therapy. It has different biological reaction, and we have studied a lot. So HIFU includes surgery and non-surgery therapies, and today we will see the HIFU's effects on the non-invasive ablation surgery. And in clinical case, we use different equipment, including USG HIFU and MRG HIFU. In the malignant tumor treatment, HIFU is very effective, and especially in the treatment of a specific part of tumors, HIFU is very effective. Starting from 1995, we use HIFU to treat malignant tumor. As you can see from the slides, it is a case of large live tumor at a maximum diameter of the tumor using 15 centimeters. And this patient's wife died 5 years ago. And actually, but this patient lived for longer time. And so, for some malignant tumors, by using non-invasive treatment, we can control the aggression and the progression of his illness. So for patients with liver cancer, by using this kind of non-invasive treatment, it can reduce the risk, and it can control the development of regional development of a tumor. And we can ensure the progress of even a total ablation of tumors. And by using a non-invasive way, we can ensure the elimination of tumor. And there are other type of tumor. And so we have worked with some doctors to deal with sarcoma by using HIFA. In terms of the treatment in the women diseases, we mainly use it to treat uterine fibroids. And many experts believe that there are differences. The first one is indication in technical level. In terms of indications of FUAS, it refers to indications in technology level refer to the range of lesions that can be treated technically by ultrasound ablation, namely the range that can be displayed by airborne ultrasound with the same sound channel. And the second one is a clinical indications is that based on the benefit risk assessment for the patient. And there are two key points. The first one is a patient with symptomatic uterine fibroids. A second, a patient with a symptomatic uterine fibroid but with a strong desire for treatment. Look at this case. You can see the comparison before the treatment and after the treatment. And before the treatment, the fibroid had rich blood supply, and after the treatment, the blood supply disappeared, and the volume of the fibroid reduced. And this slide shows the changes of contrast enhanced ultrasound and a Doppler ultrasound before and after treatment. You can see the effects. And also, now I should talk about the uterine fibroids, especially the FUA treatment of intramural fibroids. And you can see the different conditions of this fibroid in the first month, 3 months, 6 months, and 12 months after treatment. And you can see the ablation of symptoms. And we are trying our best to ensure the effectiveness of this technology, and also and we can ensure the protection to the mucosa, and we are trying our best to prevent a large risk. And on this slide, you can see a case of myomatosis, and this woman is just 21 years old, and but she has some myomatosis. And in her 26th, she approached us again because she married and wanted to have a baby. So they wanted us to give her treatment for having a baby. And the result is she successfully had a baby girl. So in this slide, you can see the long-term changes in the uterine fibroids volume after treatment. And from the graph, you can see that the mean reduction reached fibroid volume were 31.2, 58.2%, 70.3%, etc. And in here, you can see a study which is about a prospective multi-center parallel controlled study. And compared to the surgical incision, HIFA results in faster improvement in symptom scores and quality of life scores, and 6 post-treatment lower incidence of severe complications and a shorter median hospital stay. And also, the most important thing is that the patient's uterus was kept. And in terms of ESG, FUS versus MRG, FUS, the efficiency, safety, and effectiveness of ultrasound-guided and MRI-guided ultrasound ablation for uterine fibroids was studied in 94 patients. And the conclusion is that USG FUS demonstrates superior effectiveness, higher efficiency, and a shorter treatment duration. And now I would like to brief you on FUA treatment for adenomyosis. And the ablation strategy for adenomyosis is that we want to eliminate the cyclical pain, ablate the thickened lesion area with a myometrin to reduce the extent of endometriotic lesions and render the ectopic endometrial tissue non-functional in an RAMS to improve the uterine environment for conception, and we hope the local treatment methods of diversified therapy can be achieved, can be used. In terms of the result, in terms of the effective evaluation model, JC focused ultrasound tumor therapeutic system are as follows: 410 cases of adenomyosis in the first affiliated hospital, Cheung Medical College, were made, and the result shows the symptoms reduced, and we are trying to ablate all the symptoms. And in the MRI type 2, the patient's dysmenorrhea symptoms were reduced from 5 to 0. So this is a very good result, and the patient's dysmenorrhea symptoms were reduced from 7 to 1. And we have eased the pain of the patient. And we also use GnRH, adjuvant therapy, and we controlled the scope of necrosis. And in this slide, you can see that the ablation volume of adenomyosis was more than 50%, and the remission rate of clinical symptoms was 97.9%. And in these slides, we can see that a 30-year-old dysmenorrhea disappeared 12 months after treatment for adenomyosis. T2WI showed that the lesion was reduced and the shape of uterus restored. And in terms of the combination treatment of FUAS with GnRHA and Mirena, is that the conclusion is that the high-intensity focused ultrasound therapy for adenomyosis is safe and effective. Combined application can significantly improve long-term treatment outcomes. And in terms of the pregnancy case 1, we see that the HIFU was very effective. We believe that HIFU can be used to treat multiple different symptoms. The next is about the prospect for HIFU. In 2017, we have the press conference, and which is a globally leading treatment technology that is originally developed in China and made in China, was developed here. And so in future, HIFU can be used to treat different diseases. And our outlook is to, due to time limit, I will not go further. Professor Yang talked about the clinical application development of focused ultrasound application technology in benign gynecologic diseases. And the Q&A will be carried out after the three presenters finish their presentation.
I will introduce Vincent Y.T. Cheung, Clinical Associate Professor at the Department of OBGYN, University of Hong Kong, past President of OBGYN Society of Hong Kong. Now please welcome to stage Professor Cheung.
Thank you, Chairman. 很对不起，我普通话说得不大。
Sorry, I do not speak good Mandarin. I will speak in English. Forgive me.
And I would like to thank the IGSE for giving me this opportunity to share my experience in HIFU. The summary, what I'm going to talk about is I'm going to briefly talk about the development of HIFU for fibroids and adenomyosis in Hong Kong as a whole, and then I'm going to talk about the use of HIFU and fibroids, HIFU for fibroids and adenomyosis in the hospital I work at, Queen Mary Hospital, and then I'm going to give you a review on our experience on using the JC system in the treatment of HIFU and fibroid and adenomyosis. The history of HIFU in Hong Kong, we have counted way back in 2007 when, you can hear it, when there's a private hospital, when a private hospital in Hong Kong installed the Exablade, which is the MR-guided HIFU system developed in Israel. And they did 17 patients with complete treatment without any complication, and they reported that in 2009, I think. And the results show that the mean NPV was 67%, mean treatment time was 3.4 hours, and the fibroid strength by 25% at 3 months, and the symptom was reduced from 37 to 25 at 3 months. For some reason, they stopped this treatment, probably because of the fact that it is expensive, and also because the treatment time is very long. So I guess they stop it, and in fact, don't know how long they work. They do that, and then they stop it eventually. About 2012, in another hospital, at Prince of Wales Hospital, they do HIFU, ultrasound-guided HIFU using the Shanghai system, which is a little different. If you compare the treatment head of this system, this treatment head is separated on its own, but in our system it is only one piece. So that's a little different, and they use a modified protocol consisting of repeated and shortened treatment of high input acoustic intensity and intensified sonication pulses. They did it on 20 patients with 22 fibroids, and apparently the symptoms was improved from 1.3 to 0.84, and the amount of bleeding, menstrual bleeding, decreased from 278 to 185. Fibroid volume was reduced 17% in 3 months. In 2019, they used another protocol, and they concluded that the oxytocin augmented and non-sedating HIFU for uterine fibroid was better with oxytocin, and this is what they did. And again, for some reason, they stopped doing this, and I don't know the reason why they stopped doing this. So around the same time when they started the HIFU in 2012, I started to do HIFU and learn HIFU from Cheung. So in 2012, we started HIFU for the treatment of fibroid, and you can see this is Queen Mary Hospital. At 2016, we started HIFU treatment for adenomyosis, and in fact, we are the first center in Hong Kong to treat adenomyosis with HIFU. We have been using the JC system, and in this year, we are changing it to the JC300. We also published the first report on the measurement of AMH level to measure the ovarian function before and after HIFU, and we reported that in 2016. And we also present some preliminary clinical outcome on the treatment of fibroid and adenomyosis in 2019 and 2022, respectively. So this is the summary of what we have been doing. This is our preliminary experience, and you can see we report the first 20 cases, and we found that the fibroid volume was reduced by 57, 60, and 75% at 3, 6, and 12 months after treatment. So this is the summary. And as far as symptom goes, again, the symptom decreased to 40 to 50% compared with the treatment at around 3 to 12 months after treatment. So this is our preliminary experience on doing HIFU for fibroids. We're always excited to see cases that are responding, and these are one of those that we find is very exciting. And you can see the fibroid size reduced from 6 centimeter to about 2 centimeter after treatment. And in fact, these are the cases that you want to see. And if the patient has problem with bleeding and all that, you can easily resect the fibroid hysteroscopically without any problem. So basically, one of the purpose nowadays to do HIFU is to convert a fibroid, is to facilitate hysteroscopic removal of fibroid after HIFU treatment. So this is one of the purposes of doing this also. Again, another good responder for adenomyosis. You can see that this is 43-year-old woman with adenomyosis. You can see after treatment, you can see a 5 by 6 by 6 centimeter ablated area for the adenomyosis. As I mentioned, we did AMH level to measure the ovarian function after treatment. The reason is when I first doing this procedure, I always concerned that this treatment may affect ovarian function. The principle behind is whenever the ultrasound wave passes through the pelvis, there's a possibility that the ultrasound wave can hit the ovary and affect the ovarian function. So that's why I did AMH level before HIFU treatment and 1 month, 3 months, and 12 months after HIFU treatment to see whether there's any change in the AMH measurements. And we found that there's no difference between AMH level before or any time after treatment. And we thought that, and also there's no patient became amenorrhea or reported symptoms suggestive of menopause. So our experience suggested that ovarian function does not seem to be affected by ultrasound-guided HIFU in the treatment of uterine fibroids. Our study has limitations. One is the sample size is very small, and most of our patients, when we first started doing HIFU, we do it on patients over 40 years old and potentially perimenopausal, and those patients have low baseline AMH level. So whether the same findings apply to younger women of reproductive ages require further evaluation. And also the duration of follow-up was only 12 months. Following our report, there are a number of other reports that do the same test, and in fact what they find is basically they support our experience that ultrasound HIFU does not affect ovarian reserve. Lastly, I'd like to review our experience from Queen Mary Hospital using the JC system. As I mentioned earlier, we are in the process of changing to the JC300, so I hope that with the use of the newer machine, we have wider application, less case exclusion, and better outcomes. The reason why what I mean by less case exclusion is because we have excluded quite a number of patients with adenomyosis with the JC machine because the target is too small and the image is not very, very good. So we decided not to do that. Again, this review the follow-up of patients that was discharged from the clinic. So we have a long follow-up duration of up to 95 months. So you're talking about 8 years of follow-up after HIFU treatment. And in some way, we look at the long-term effectiveness of this treatment. In fact, if you look at a lot of studies on HIFU treatment, the follow-up period is only 2 to 3 years. So the long-term treatment is also very important. So that's why we have been following up quite a number of patients for about 5 to 8 years. We have 81 patients performed in 79 premenopausal women and 65 women for fibroids and 14 for adenomyosis. If you notice, these are the patient's characteristics, and if you look at that, there are a number of patients. One patient with fibroid and one patient with adenomyosis is 2 treatments. The reason behind was different because for the patient with fibroids, that patient, I have 2 treatments for one patient for the fibroid because she had multiple fibroids, and I did the HIFU as a 2-stage procedure. But for the patient with adenomyosis, I did it twice because after the treatment, she's not satisfied with the result. So I repeated again, and she actually requested to have it repeated again. And that's why this is a treatment failure for the first HIFU treatment. So the outcome is different. So for the patient with adenomyosis, the repeat one is a re-intervention. But for the patient with fibroid, it is not a re-intervention. It is part of the procedure. So as I mentioned, the follow-up duration was up to 95 months, so it's almost up to 8 years, and adenomyosis up to 5 years. Complications is probably most important, I think, because we need to do it safely. And we do have some complications, I must admit that. And for fibroid, the major complication rate is 1.5%. The most severe one is patient with pelvic inflammatory disease and septicemia, but for the patient with adenomyosis, we do have one patient with bowel injury, unfortunately, and there's another patient with prolonged pain during nerve injury. But other than that, there are other minor complications. Changes in fibroid volume and symptoms. For fibroid volume, we find that the fibroid volume was reduced by 50% at 6 months and 66% at 12 months. And for symptom, the symptom was reduced by 44% in 6 months and 50% in 12 months. So most of them have an obvious improvement of symptoms and the volume size. For adenomyosis, we do look at uterus and adenomyosis volume, but I think as far as treatment goes, for women with adenomyosis, I think the symptom improvement is most important and the size of the uterus. So let's look at the symptoms, and we measure the menstrual pain score, and we can see that at 6 months, the menstrual pain score was reduced by 60%, and at 12 months, the menstrual pain score was reduced by 50%. And for symptom severity score was reduced, at 3 months was reduced by 38%, and for 12 months was reduced by 20%, by 40%, I'm sorry. Most important is interventions. It is quite important as far as patient goes because I think this is the big questions the patient asks me when I offer this procedure. The chance that a patient with fibroid at least re-intervention in our series is 21%. But when we look at that, there's quite a number of them have vaginal hysteroscopic myomectomy. And in fact, nowadays, we look at this hysteroscopic myomectomy is part of the procedure. In other words, the HIFU facilitate this procedure. So that's why I have a readjusted rate, which in fact, we take those patients out, the patient who had hysteroscopic myomectomy out, and the adjusted rate was only 10%. So in other words, 10% of patients needs re-intervention, like hysterectomy, myomectomy, that sort of things, all right? Because I don't think we should include those with hysteroscopic myomectomy. Adenomyosis, the intervention rate is a little high, it's 35%, partly because our number of patients is not that many. We have 3 patients who had hysterectomy, 1 patient who had adenomyomectomy, and 1 patient have repeat HIFU. Pregnancy after HIFU, we have 1 patient with adenomyosis, has spontaneous pregnancy 24 months after HIFU treatment. Antenatal cause was unremarkable. She had an emergency cesarean section, fulfilled induction at 40 weeks gestation. Baby was perfectly well. So we have basically not much concern with that as far as pregnancy after HIFU goes. So in summary, ultrasound-guided HIFU provides symptomatic relief to most patients with uterine fibroids and adenomyosis, and is a promising uterus-sparing treatment alternative for patients with these conditions. Thank you for your attention.
Thank you very much, Mr. Cheung, for your speech. You talk about your experience in protecting pregnancy. Actually, after reading his team's study, we have made a further study, and we made other studies, so this is a good connection between us, and we believe that in future, by the collective efforts of doctors, we will see more applications will helpful in other areas. Thank you. Okay, now I will to brief you on the next speaker. She is Alishin Ali. She is the MD, Chief Physician, Professor, Master and Doctorate Tutor. And also, she is Deputy Director of HIFU Center of Shanghai First Maternal Infant Health Hospital. She had many different positions in different medical organizations. Thank you very much for your introduction, respected friends. I'm honored to have the chance to talk about our researches. We mainly deal with the adenomyosis. Our first patient was a patient with a serious adenomyosis. She is our first milestone because there is no recurrence of her disease, and a total of a whole 400 patients received our treatment by HIFU. Because in Shanghai, I see 100 patients, and 40 of them with the disease of adenomyosis. We expected to see 500 patients of adenomyosis per year, but due to COVID, this goal was not achieved. But coming back, we know we have some front runners, as shown in the slides. We all know that adenomyosis is a benign uterine disorder characterized by the presence of heterotopic endometrial glands and stroma in the myometrium and reactive fibrosis of surrounding smooth muscle cells of myometrium. In 2004, when I was learning from an Australian professor, she asked me one question. After the cutting of a gland, will there be a reoccurrence of adenomyosis? Let's look at the characteristics of this adenomyosis. Some bleed a lot. Some patients could not give birth to a baby. And when Professor Jordi was presenting this morning, many people asked him questions, which are good questions. In 2019, there was a new technology started, and we were thinking which technology is the best for patients. We need to base on the age and the conditions of the patients to choose the right way of treatment. And for patients coming to our hospital, they didn't want to do operation, but they have serious symptoms. One of patient's friend said that if her friend knew me earlier, her friend would not have died. Actually, we have very good professors here, and we have found something interesting while we were learning abroad. In foreign countries, doctors of reproduction department also do something in gynecology, but in our hospital it's different. I think that doctors better know both areas, I mean reproduction and gynecology. And I have a very special case. After using HIFU, her symptoms were greatly reduced. But I want to warn that while using HIFU, we must be very allergic. When the tumor is bigger than 3 millimeter, we can use HIFU. I told a doctor within our hospital that HIFU represents spring of our medical treatment in adenomyosis. And we have discovered that we still have a lot of doubts on using HIFU to treat some diseases. And there are different types of HIFU, of AM based on MRI findings and HIFU treatment. And in this slide you can see the different types of adenomyosis, which were firstly proposed by a Japanese professor. In terms of imaging and HIFU treatment of AM subtypes, we categorize them into 6 types, and we have found that there are differences in ablation between different patients. Starting from 2015, we have treated 3,000 cases of patients. There were questions raised, such as there is no pathology for patients with adenomyosis. So we use drugs, in total 6 drugs to control the size of uterus, and also we did some endometriectomy for some patients. Some people question HIFU does not have no pathology, but in our operation, we have some cases, and we have proved that HIFU is effective. And by using HIFU, we even discovered that the patient does not have a very malignant tumor or disease. In 2015, patients of adenomyosis treated in our hospital, we have left hospital, and I was asked that whether the dead tissues or necrotic tissues will cause a bad effect. But through our study, and we made very long-term researches. What I want to share with you is that for thrombus and some similar symptoms operations, and we did some researches on gynecological surgery by using HIFU. The purpose is to investigate the effect of HIFU treatment for uterine fibroids and adenomyosis on coagulation indicators. And our method is that paired T-tests were applied on coagulation indicators measured for before and after HIFU treatment using multiple logistic regression models, adjusted odds ratios, and 95% confidence intervals were reported to evaluate the association between the risk of upgraded D-dimer, fibrinogen degradation products, and HIFU treatment parameters categorized into tertiles. And this is the results. You can see the result before and after operation, and we categorize these parameters, and we have low, medium, and high. In the very beginning, the index is very high, but later we can ensure that there is no very serious result. And the high energy group represents high risk. And this shows its relation with FDP. So I think that HIFU's energy and coagulation function is directly correlated. So our conclusions are high exposure energy in HIFU treatment may induce coagulation function changes leading to hypercoagulability regulatable state post-treatment. This is all. Thank you very much. Thank you very much, Professor Alishin Ali. Thank you for sharing with us the cases and researches in your hospital. Thank you very much. And I hope that your papers will be received. Now, next speaker is Mr. Xu Hua. He is from Fudan University Hospital, and he is medical doctor, postdoctoral researcher, and doctoral supervisor, and postdoctoral doctoral supervisor. He is also director of radiology department and director of imaging intervention department. Now floor is yours, Professor Xu.
谢谢主持人。今天我跟大家分享的题目，题目在哪里？这就是
Thank you. So, my topic is a new focused ultrasound strategy for T2 hyperintense uterine fibroid and adenomyosis. If we have experience of hyperablation, we will encounter T2 hyperintensity, which is a contraindication. That's not the case. While there are a lot of contraindications, whether it's type 1 or type 2, so for those under the perimetrium, some people said it was not possible. We did that. We did some explorations to 20 centimeters, and now it's the hyperintensity. And I will skip the development of focused ultrasound ablation, and this is really a great equipment. I used other companies' equipment before, and to compare, this is the best one because it has the best ablation and best efficacy. We use the ultrasound guided. Ultrasound guided is better because it is quite intuitive. But via vagina, when patient moves, the accuracy is a problem. After the ablation, it may cause some heat, but if I use the ultrasound guided HIFU, if there are some residue, we can see that use enhanced imaging, and we can continue the ablation. So these are the approaches of focused ultrasound applied. So there are a lot of cases and studies around the world. One thing we do is that so we stimulate the ovarian for POI and PSOC patients using focused ultrasound. So we want to do a PCOS or POI clinical study. It can actually stimulate the ovarian, and the female can start to have menstrual again. So this is a new one that I want to mention. One layer, the rear layer. So the energy of the focused ultrasound can be used to have 100% ablation and avoid the high temperature and burn of the skin. Of course, there are skills involved. Why I want to do 100% ablation? Because we're going to have a competition with GYN. I'm an interventionologist. If I do not this good, and GYN would say that see that this doctor is not okay. And we have G1 has alternatives, but for us, we do not have alternative. So we want to have 100% ablation to have better clinical results. This is also a result categorization based on a doctor from Japan, but that's not the case how we classify. This is the T2 signal. It's easy to ablate this one. Well, this is MRI guided. It's okay that we can do it. And this is a huge fibrosis with a rich blood supply. And if we see the MRI, you can see a lot of blood vessels. We can do 100% ablation even for this. So I published an article that so different from the RFID and microwave for focused ultrasound, there's basically no heating-seeking effect. So no matter what, it's best for us to cut the blood supply. So for T2 hyperintensive signals, there may be some influences. Another case that I want to share with you is T2 hyperintensity. Well, the mild ones are the most difficult ones. We can see very rich blood supply, and we also achieved 100% ablation, the best performance player. So we are doing it as an art piece to avoid recurrence after intervention. So this is fibroid, another case. Maybe there's some residue after ablation. The residue may cause recurrence. So I paid very closely attention, and we did a lot of irradiation, and we can see really light colors. So even if when the temperature is very high, the ablation is not good. So I assume that after 6 months there will be reoccurrence. And the patients would say that it's not good, and the surgeons would say it's not good. Open surgery is the best. But that's not the case. T2 signal intensity, even it's high or low, can achieve 100% ablation. So this is T2 hyperintensity with rich blood supply. Well, the little residue will cause reoccurrence. Also, the mass volume is reduced, but after 2 or 3 years, there will be fibrosis again. This bothers us. We can treat it for the second time, but it will be difficult. Another case, this patient wants to do non-invasive. It has T2 hyperintensity. We had a try. After treatment, maybe 5% of ablation. How about that? The patient has had hope. What's the solution? We have to have some new solutions. At the very beginning, we use ethyl iodized oil to change the structure within the fibroid. So it's useful, but not as good as Lauroma. So this was used for anesthesia. So in 1993, it is used to stop the vein. So I saw a case to inject the Lauroma. Well, this has overspill, but that can be actually very safe. So I started to use the Laura Macrogo as a substitute. It has also been, this practice written into the expert consensus. So it's easy and safe. They are injecting the Laura Macrogo alcohol. So this one we can champion a new practice. And we also use the low-dose mifepristone or subcutaneous injection. They are just aiding methods. This is after we inject ECO iodized oil. For low-intensity ones, it's good, but for high-intensity ones, it's not good. Maybe it will not grow up, but to minimize, to reduce, it's difficult. So this case, another patient, 44-year-old with a T2 high intensity. We thought it won't do directly with HIFU, and after the TCM treatment, the fibrosis went up, and we administered a low-dose mifepristone, and this patient insisted that she use the non-invasive method. She doesn't want open surgery. So we use Laura Macrogo injections and then HIFU guided by ultrasound. After injection, we can see the image. 10 minutes later, we treat HIFU, so it's perfect. So for this case, the doctors may feel it's difficult, but we can do it. There's another one with T2 hyperintensity. Patients would suffer pain if we directly go with HIFU, but we can actually administer the Laura Macrogo. Well, some people say that there's no pathological tests. When we do the treatment, we actually do a full array of tests of labs, and we even study why the fibrosis shrinks and then goes up. And we also study why the ablation did not occur 100%, but the fibrosis keeps shrinking. So this is another patient, hyperintensity, thought to be impossible. The fibrosis went up, and then we had HIFU directly. There is no result. The mass keeps going up. So we can also inject Laura Macrogo. We can see very obvious shrink. So if you are not successful directly with HIFU, you can try with the Laura Macrogo. This is another patient with a T2 hyperintensity, DBLS high, KI 67, less than 1%. And we can see a needle going in. So the posterior, we injected Laura Macrogo. After that, with HIFU, it's perfect. Another case I want to share with you, low intensity. We thought it would be very successful. We were very confident after treatment. We can see the result. The ultrasound contrast enhanced ultrasound. We did not find blood supply, but after the Laura Macrogo combination, we can have 90% of ablation. And this patient is about to conceive, and she wants to have 100% ablation. We think it's okay. The energy should be controlled within 250 joule, because after that we can see some neural lesions, the burn of the skin, the feeling of the patient. You know, the L'Oreal Macrogol was first used as sedatives, so the patient would feel very good. And this, number 8, and with fibroid T2 hyperintensity, even if we injected the L'Oreal Macrogol, it was not the ideal one. The ideal one is HIFU combined with L'Oreal Macrogol. And the number 1, adenomyosis. Cases are not always 100% ablation. So it's different from the single-layer fibrosis. If you use only the HIFU, maybe there's no impact at all. You will know that kind of cases. You treated fibrosis like this before. After we injected the L'Oreal Macrogol, we see good results. So it's actually a very accurate targeted injection. So this from 2 years, and now the uterus is in normal shape, and she is preparing for pregnancy. So in summary, it is difficult for focused ultrasound ablation of fibroids with high signal intensity on T2WI. Not only difficult to predict the treatment efficacy, but also difficult to achieve a good effect. Some patients are lucky to have good results. However, we should adjust the inner circulation. When we inject, it is becoming a foam. So we can also reduce the dose. It can be great basis for the result and efficacy. So that's why we are doing the efficacy research to have a new way. If the results do not come well with low intensity, we can still inject more the L'Oreal Macrogol. So this is both physical and chemical approaches to protect our patient to protect our patient to the maximize. So to conclude, I want to do an advertisement, Springer, a book. So surgical techniques of focused ultrasound ablation in benign uterine diseases. Even for some malign cancers, some liver cancers, with the use of L'Oreal Macrogol, it can also have a good treatment for liver cancers, for not only fibroids, but also other cancers. We can actually think about a good choice of using the L'Oreal Macrogol, and it reduces pain and it improves efficacy because it involves lidocaine in it, so we can change impossible to possible. Thank you. Thank you, Professor Xu. It's a good example in practice. As a GYN surgeon, for that kind of patients, we would use surgery. For interventionist, you use the medication, and good results can come out of with the medication new approach. Thank you once again. And next, I would like to invite to stage the 3 speakers to have this Q&A session. Professor Vincent Y.T. Cheung, Aixin Zi Ali, and Xu Yonghua. Please. So, any
questions? Okay, Pastor. Our center is also using the ablation technology, and I want to ask where to do the ablation. In the very beginning, you try to use it in the rear part. Now, you must do it in the rear part instead of in the front part, and then move it forward. And don't be urgent. Take your time. And wait till the tube spread. We know that when we are using the ultrasound, when there is a bright part, we know the effect is good. So, after the patient is injected with our ablation agent, he or she doesn't feel pain, it is good. Thank you. I want to ask how much the lower macro goal should be used. And what about the time? In the foreign countries' papers, it says about the 40 ml, below 40 ml. And some people say it is 35 ml. We should mix it at a rate of 1:1 or 4:1. The needle we used has very small holes. So we do this very fast. So you don't have to do it continuously and very fast. You can wait for it to spread.
Thank you very much for the brilliant presentation. I have one question for you. What was the way of using a venous-sclerotic lower macro goal? Could you describe, please, several words about this way of using?
We use, the way we use is the one-to-one air, mix it, and then directly puncture to the
direct.
Yeah, exactly. From the
yes,
abdomen.
Transabdominal, yes,
yeah.
I see. Thank you very much.
Okay.
Yes, yeah.
You have no resorption into the circulation?
No, because we know the bladder, the out, and actually it's very tiny, and also they can stop the bleeding. This medicine. So don't worry about it.
Do you have video of that?
Yeah, yeah. We'll have video. Next time we will show you. Okay, it's pretty clear. Yeah.
Sorry, is it enough one injection or needs more?
One injection.
One injection. Thank you very much.
Yeah.
我这里问题特别多，每次。
I have a question for you, Vincent, if I may. I was a little bit shocked by the percentage of re-interventions that you had. So you had, I think, 30%.
For adenomyosis, yeah.
Yeah, well, for adenomyosis.
Yeah.
Why is that? That is so high.
I can tell you the reason. One is our number is so small. So if we have 15 patients or so, and if you have one patient, the percentage will be more than 10%. Yeah. That's one reason. The second reason is because a lot of physicians, a lot of gynecologists, they are not very familiar with HIFU.
Okay.
So the problem is if I finish the HIFU and they went somewhere else to see another doctor who is not familiar with the HIFU, if they start complaining they don't believe that HIFU works, then the tendency is if they start complaining a little bit of heavy bleeding, then they say that they will need a hysterectomy.
Okay.
And then that's another reason. And in fact, I can tell you, one of the patients who had adenomyomectomy, which I show, actually have the procedure in China. So in other words, even in China, not all centers are familiar with this procedure. And after that patient actually went to China and have adenomyomectomy. We don't do adenomyomectomy very often. So China have more experience with adenomyomectomy, and she went there and have it done. So I think two reasons is the number is small, and the second is the physician is not familiar with the procedure, so that's why they have a tendency, they thought, oh, this is a new thing, this probably not work, and that's why the intention is they don't think it's work, and they go to re-intervention more readily than we do.
So your series is not performed by only one HIFU specialist like you, but by many doctors?
No.
And the follow-up? Okay.
The follow-up is by other doctors, or even all the cases are done by me. The thing is, when they go to follow-up, some of the patient may go somewhere else for follow-up.
Yeah.
And that's the problem.
Yeah. And that's not good.
That is not good, but this is
the follow-up should be done.
You can't stop people seeing
we have
other
the
doctors.
same problem in Europe,
So that is the reason, and that's why a long follow-up is important.
Yeah.
All right, a 2 to 3 years follow-up, like many other studies, is not going to give you a good picture.
Thank you, Officer.
Thank you. Thank you.
三位老师好，我来自山西省临。
I'm from Shanxi Province. I want to ask a question to Ai Xingzi. So in treating adenomyosis using HIFU, after treatment, 1 month, after the treatment, the menstruation was not controlled, so heavy bleeding for the first month, and interior wall is very thin. We are also thinking about the removal of the.
这个问题特别好，就我们刚开始呢，是特别大的，因为我前面也说了，我们一般不买。
As I said, we treat a lot of patients with big tumors. So for these cases, it is impossible for ablated in the first shot. And there is a model which is called 633. 6 means when the uterus is smaller than 60 mm, and the estrogen should be smaller than 30 mm. So in some cases, there is massive hemorrhage. So for patients, after injection, we would rather use mifepristone. And this medicine is very cheap. After the first injection, we must use mifepristone to control hemorrhage. After my patient received the operation, her pains went away after my operation. After doing the third days after HIFU operation, her period went away. So some people from HIFU Medical Center thought that my experience and my cases are quite precious, and we can see different conditions of different uterine cavity. So we can't let the patients to have period after using HIFU. The conditions of dysmenorrhea of patients is very complicated. There is a team that has been studying dysmenorrhea all the time, but I dare not do that. And my team are doing something else. And after doing HIFU, it's like a magic. Ablation is not an instant thing, and the different patients have different conditions. And we are studying the uterine fibroid absorption condition. So you need to let the patients to control the period, which is very important. And I said for many times that for some cases of adenomyosis, there are only two alternatives. First one is hysterectomization, or do the mastectomy. And I had some discussions with many professors, and I am very happy that many experts think highly of HIFU, and I'm happy to see that many young doctors are thinking highly of HIFU. So I want to stress that the controlling period is very important. And for some cases of adenomyosis, if they does not have a period, this is the best treatment. Every time when a female went to see me, she may say period is very important, but I feel heartbroken because I don't use.
Get Miranda, they won't get Gynaecology and all that. So it's really just purely I want to see how the HIFU did. So that's what I did, and that's why people advocate combination therapy for adenomyosis。就是一个原因就是我不用配合治疗的，我只是做HIFU，我不用 Miranda， 不用 Gynaecology， 所以病人复发的机会高一点的。对。
Using two ways may lead to recurrence. Due to time limit, I thank you very much, Professor, for your answering, and I believe that there are more excellent part. Now let's invite the next moderators. Professor Liang Yanchuan, Professor Fu Chun, and Professor Hao Xin.
And let me introduce the first speaker of this section, Dr. Selva. Yeah. Dr. Selva is a consultant obstetrician and gynecologist and a specialist in reproductive medicine at a private hospital in Malaysia. He has the IVF center and HIFU center at the hospital. Dr. Selva is a past president of APEC and the Obstetrical and Gynecological Society of Malaysia, and is involved in promoting gynecological endoscopic surgery in Malaysia. He started the first HIFU center in Malaysia in 2021. Let's welcome Dr. Selva.
Okay, thank you. Firstly, let me thank the organizers for inviting me to speak today. Now, I might be the youngest person doing HIFU. Many of you all have done HIFU much more than me. But I have been doing IVF for 25 years. I have been doing laparoscopic surgery for 30 years. So I'm going to combine these two and see how HIFU can help, especially my infertility patients, to achieve a better chances of pregnancy. Now, this is my disclosure. I have been doing HIFU in this hospital since 2021, and these are a number of cases that I've done. I started in the middle of the pandemic, in 12th of July 2021, and until about 2 weeks ago, I've done 581 cases, out of which 366 are fibroids, and 215 are adenomyosis. So I'm just going to explain how I select patients, especially patients with infertility, when I perform HIFU for them. Now, many people will ask me these two questions. The first question is, how does HIFU affect ovarian function? Thankfully, Vincent has already answered this question, so I've got not much work to do here. Second is, does HIFU affect the endometrium? This is the next question that people will ask me, so I'll try to answer these questions first. Now, the first question, as what Vincent has said, is, now, when we shoot the beam into the fibroid, this is how it goes. The focal point is here. This is where the maximum damage is, but there is still some energy that is involving these areas. So as you know, fibroids are all over the place. When we ablate the center, the ovary will not be affected. But when we ablate the sites, there is a chance that we may affect the ovary. So it's always in our mind whether there is some ovarian function that will be affected. But as what Dr. Vincent has said, there are studies. This is only one study that I showed. I know that Dr. Vincent has got his study much earlier than this, and they have done studies that show that the AMH level before and after HIFU has not much of a difference. So we can safely say that HIFU most probably will not affect the ovarian function unless you're doing fibroids that are very lateral, very to the left side or to the right side. Okay, the next question is, does HIFU affect the endometrium? Now, when we ablate an anterior fibroid, we are not going through the endometrium. We are going right here, and the endometrium is not affected. But when we are ablating the posterior fibroid, like here, posterior fibroid, we are going through the endometrium and hitting the fibroid behind. So it's always a worry whether the energy that is going through here, will it affect the endometrium? It's always in everybody's mind. And this is a study that was done that actually they took endometrial samples from the endometrium of women before and after HIFU, and they found that it did not, and they looked at a lot of factors. I don't want to go through all these factors, things like penipodia and a lot of things, and they found that it does not affect. So we can safely say that the HIFU will not affect the endometrial cavity, but I think we need more research on this to reassure us, especially IVF specialists, that when we shoot a beam through the endometrium to the posterior wall, the endometrium is actually not affected by this energy. Now, the next question I always ask myself is, if you have a fibroid like this, and this is the fibroid, and you ablate, does this ablation at the capsule here near the endometrium, will it affect the endometrium or not? These are submucous fibroid, or maybe type 3 submucous fibroid, even type 2 submucous fibroids. This is another example. For example, this fibroid. This lady has a fibroid right in the center of the uterus. This is right in the center of the huge fibroid. It's about almost 10 centimeter fibroid in the center of the uterus. If we were to ablate this, will the ablation affect the endometrium? I think there's no answer. There's no study to show that if we say we give GnRH analog, shrink it, and do TCRF, are we going as much damage or less damage than if we are doing HIFU for this patient? For this particular patient, this was the ablation that I did, and 3 months later, almost all the fibroids have come out. So it's good for her, but is it good for the endometrium? I think we got no answer to it. We still do this when young girls or women in the single, and they don't want anything to go into the uterine cavity, want to do HIFU, and they have a large submucous fibroid, which is very difficult to do TCRF. I always talk about this balance between doing a transcervical resection and doing HIFU, which is cause more damage to the endometrium. And I think we don't have an answer to this question. Okay, next I will just talk a little bit about my experience when patients with fibroids who want to get pregnant come and see me, and how do I choose whether I will do a laparoscopic myomectomy, open myomectomy, or do HIFU. And this is always a debate, which is a better option. Now, in my mind, when we talk about myomectomy versus HIFU in patients with infertility, if the patient comes with recurrent fibroids, say the patient has undergone a myomectomy before and she has another fibroid, and she said, can you do HIFU for me? I will not hesitate, I will do HIFU for her. Now, if the patient has multiple fibroids, there's a lot of fibroids, and I know that if I do the surgery for her, within 1 or 2 years she's going to come back with fibroids, then I will not hesitate to do HIFU for her. Single women with fibroids, yes, we don't know when they are going to get married, when they are going to get pregnant, then I will not hesitate to do HIFU for these patients. However, if a patient has got a large fibroid and she's keen to conceive as soon as possible, I usually hesitate to do HIFU. Because if I do HIFU, it's going to take time for the fibroid to shrink, and she's going to come back to me and bug me, I'm not getting pregnant. Is this fibroid going to cause me difficulty in getting pregnant? So these are the group of patients, especially if the patient is about 35 to 40 years of age and she has a large fibroid, then I will tell her that I can do HIFU for you, but maybe surgery is better for you, because if I do surgery, after 3 months, 6 months, she can get pregnant. But there are enough studies to say that even if you do HIFU and the fibroid shrinks, they can conceive on their own. But I am always on what I call as on the safer side, where I say that maybe myomectomy is better for you, but if they insist, then I'll do HIFU for you. So this is always a debate when you are an infertility specialist, which is better, to do myomectomy or to do HIFU. And I have got both the facilities. I'm not a person who only do HIFU. I can do a lot of things, so I can tell them that these are the options, you decide. Sometimes they ask me, what is your option? Then I use this as a guideline, as a way to decide which patient is better to do HIFU and which patient is better to do myomectomy. Now there's another group of patients that I always have difficulty. These are the group of patients who have small fibroids, say 2-3 centimeters fibroid or 3 to 4 centimeter fibroids, and they're not getting pregnant. This is a review paper that I wrote some years ago, intramural fibroid and fertility, to operate or not, that's by me. And in here, I studied all the different methods available. These are patients with, say, type 3 fibroid or even type 4 fibroids. These are fibroids sitting in the myometrium, not touching the junctional zone, not touching the endometrium, but they are not getting pregnant. What are we going to do with them? Are we going to operate on them to take out this small 4 centimeter, 3 centimeter fibroid? Can we look for another option? And these are the groups of patients I think HIFU will be a good choice. And I actually give you an example of a patient that I did this, and the patient conceived. So this is another group of patients that may be a good candidate. Instead of opening them up and taking out the fibroid, may be a good case to consider HIFU. This is an example I give you. This lady has this small fibroid. She was not getting pregnant. Her fibroid is not big. There are 2 small fibroids. I could easily do laparoscopic myomectomy for her. This is how it looked on this one. It's one fibroid here and one fibroid here. It was touching just about touching the junctional zone. And this is the contrast MRI. And you can see that there, you can see the fibroid there, this fibroid and this fibroid, 2 fibroids. And this is the contrast MRI. This is after I've done HIFU. HIFU was okay, not very difficult, simple case. And this is 3 months later, the fibroid became smaller. And she conceived and she got pregnant. But I also was worried, if she doesn't get pregnant, then we may have to go and do a surgery. So this group is a group of patients that we can consider HIFU as an option, as opposed to doing surgery for these kind of patients. Okay, next we go, this is the patient. What happened is after 3 months, the fibroid shrank, and this is the first fibroid, the big fibroid shrank by 49%. The second fibroid shrank by 58%. And I do 3D ultrasound to measure the fibroids. And as I said, this patient actually conceived and she delivered normally. Okay, next we come to the awful subject of adenomyosis. This is a much more difficult topic, and this is my favorite topic. Now, as what Hugo was asking us just now, fibroids are easy. They have got a capsule, and you can ablate, and you can even ablate 100%. It's not a problem. But adenomyosis is a different ballgame. They are all over the place. It is impossible to do 100%. It is everywhere. It's right up to the serosa, it's right up to the endometrium. And it's even more difficult when you're doing for patients who want to get pregnant, because you need a barrier of about 1 to 1.5 centimeter from the endometrium. And here you need a margin as well. So you have to be much more careful when you're doing HIFU for adenomyosis as opposed to fibroids. And recurrence rate is 100%. I'll tell you it's 100% because I have not ablated this part. I have not ablated this part. It's going to come back if you don't do anything. So I always tell my patient, if they ask me, what is my chances of it coming back? I tell them it's 100%. I'm just helping you to reduce the volume of your adenomyosis. And if you take a GnRH and if you put in a Mirena, there's a good chance that we can delay it for 5, maybe 6 years. That's how it works for adenomyosis. But for a person who's going to want to get pregnant, my ablation has to be even more careful. That means I have to ablate even lesser than a patient who doesn't want to get pregnant. So if you don't want to get pregnant, I will do a more aggressive ablation, and more disease will die, and your chances of recurrence will be lesser, as opposed to a person who wants to get pregnant. Okay. So as I said here, there is a difference in ablation in a person who don't want to get pregnant, because I can do extensive ablation, and I can even include the endometrial cavity, and the success rate of reducing symptoms will be good. As opposed to a patient who wants to conceive, I have to be very careful not to involve the endometrium. And as what Dr. Ising Lee has said, some of the adenomyosis actually reach the endometrium. It's impossible sometimes to control the energy not to involve the endometrium. And sometimes I wonder whether if the endometrium is already involved, ablate it and let it die and let new endometrium form. That may be a concept, but I don't think Cheung agrees with me on that. So you see, when we see patients with adenomyosis, these are the group of patients that I see. Those who are not keen to get pregnant, very easy. I can do fantastic ablation. Those who are keen to get pregnant, then we have 3 groups of patients. Those who have frozen embryo, those who are still single, and those who want to get pregnant spontaneously. And this is the group that I don't like. These are the 40-year-old single ladies who are not sure whether they want to get pregnant. I don't know whether to do a complete ablation or a careful ablation. Today I will talk about pregnancy. I like this group, those who have frozen embryos. Now, if a patient has got a frozen embryo, these are patients actually who have done IVF, who have failed embryo transfer, one, maybe twice. And then they are sent to me, can you do something about this and the adenomyosis? Please kill the adenomyosis, make it smaller for me so that the patient can get pregnant. I love these patients because if I succeed, I'm a hero. If I don't succeed, I say you have terrible adenomyosis. So I have got no problems with this. So I like this group of patients. So I have to do the ablation very carefully to prevent the involvement of the endometrium. I usually give them a GnRH analog for 3 months. And then I will refer the patient back to whoever the patient is doing IVF, and I'll ask them to do the embryo transfer. And I ask them to do the embryo transfer before their menses comes. That means while the uterus is at the smallest size. In my experience, the uterus becomes the smallest about 3 months after the GnRH. And usually GnRH lasts more than 3 months. The ones I give are the depot, which are the 3 months one. It usually lasts 4, 5, 6 months. So at 3 months, the uterus is the smallest. That's the best time to do the embryo transfer. I'll give you an example. This is a lady. She's 35-year-old, married for 5 years with no children. In 2019, she underwent IVF, had 2 frozen embryos. One embryo was transferred in June 21. She did not conceive. Then her uterus was about 16 gestational week size. Ultrasound showed a large posterior adenomyosis, 9 by 10 by 8 centimeters. And this is how adenomyosis looked. It was a large right-sided adenomyosis. It was almost involving the endometrium. This is how big it is. And this is the power setting I did, 146 seconds, 1,335. And these are the power setting. I think those who are doing HIFU will know what this is all about. So this is how the adenomyosis looked like. And this is the MRI done 3 months later. So we had almost a complete, I didn't do immediately, but I did 3 months later. This is how the adenomyosis looked like. And this was the volume changes by ultrasound after HIFU. So at the beginning, it was 946.92 centimeter cube. For those who don't know, the normal size of a uterus is about 60 to 80 centimeter cube. So this was almost 10 times the size. And at about for 6 months, I think it's about 6 months, it was 265. This was my first case, so I waited. And I sent her back to her IVF specialist. And she did the frozen embryo transfer. She did not induce bleeding. And she gave, those who do IVF will know that we will give Proganova for, this is estradiol valerate, for 11 days, and then added utrogestin. And then she did a frozen embryo transfer on the 25th of June 2022. And recently she delivered by cesarean section. This is her photo. She allowed me to show this photo. So far in my series, this is my series, we have 8 adenomyosis patients, 5 have delivered, 4 by cesarean section, but unfortunately 1 patient died. The baby died at 28 weeks, and she delivered by SVD. 2 miscarriages, and 1 is ongoing. In my fibroid list, 7, 6 delivered, 5 LSCS, 1 SVD, and 1 is ongoing. This ongoing patient is actually a patient with multiple fibroids, and HIFU was done. She couldn't get pregnant. We did IVF, did embryo transfer, and she's now 16 weeks pregnant. So in summary, offering IVF, HIFU for patients with fibroid must be done very carefully. I think when we do patients who want to get pregnant, if you want to do HIFU, you have to discuss very carefully, because we have a good alternative, that is surgery. For those who don't want to get pregnant, I think it doesn't matter. HIFU is probably the best choice. But those who want to get pregnant, we have to be very careful. And you must discuss the pros and cons of HIFU versus myomectomy. Let the patient decide which one they prefer. Each has its own advantages and disadvantages. As for adenomyosis, HIFU is probably superior to adenomyomectomy in patients who want to conceive. That's what I think. I've reviewed the articles. The studies have showed that those who do adenomyomectomy, some have even quoted up to 50 to 60% pregnancy rates, but those are done by people very good, like Osada, who are very good at adenomyomectomy. So they get, and their uterine rupture rate is very low. But those who are not doing, we are always worried about uterine rupture. Not all adenomyosis cases are the same. In some adenomyosis cases, the ablation is easy. In others, it's very difficult. In women with adenomyosis who have difficulty in conceiving, especially after failed IVF, HIFU is an option to shrink the adenomyosis before embryo transfer. There are many challenges in performing HIFU for these patients, including how much to ablate, how to avoid endometrium. This is always my fear, because those who do HIFU will know that we cannot see very well the ablated areas. Sometimes we can see the grayscale very clearly, sometimes we can't, and when we do MRI, the ablation is actually gone to the endometrium, so it's sometimes very difficult. The next difficulty is to decide when is the best time to do frozen embryo transfer. My suggestion is at 3 months post-HIFU. I also use the CA125 to decide when to do the HIFU. So I usually do a CA125 before HIFU, and then follow them up. When I follow them up, I'll check the CA125. If it did not become normal, I'll give the generation until it becomes normal, then we do a frozen embryo transfer. Now, HIFU can also be done in patients with adenomyosis who want to conceive spontaneously, but she must be prepared to repeat the HIFU treatment if she did not conceive and the adenomyosis recurred. I have not had the experience of a patient whom I did HIFU and the patient conceived spontaneously, but I recently reviewed the literature in China. There are a lot of patients who conceive spontaneously, but I have not been that successful. And in this kind of patients, I always tell them that if you don't get pregnant, either you choose IVF as soon as possible, or you may have to come back for a second HIFU in 1 or 2 years' time if you don't get, because it's going to grow back. And here we have to consider IVF early in these patients. Okay, thank you.
Thank you for Dr. Selva. He has answered 2 questions of HIFU. And first is whether HIFU affects the ovarian function of these patients, and the second question is whether HIFU affects the endometrium of these patients. And he also tells us many evidence from the published articles, and according to his experience of his daily clinical work, we can see many successful cases in the patients with infertility complicated with fibroids and adenomyosis. And thanks for Dr. Selva again for your presentation. Thank you. Thank you.
好，接下来就是讲者。
And next, I will invite to stage Liang Dong. Liang Dong is the head of department of ABGYN, People's Hospital of Foshan City. She is also chief physician, master tutor, and postdoctoral cooperation tutor. And her topic is comprehensive treatment for adenomyosis patients with facility needs.
And today we are talking about the comprehensive treatment for the adenomyosis patients with fertility needs. And firstly, we'll start with a special case, and then we will talk about the clinical feature of adenomyosis, and lastly, we will discuss what ideas we can apply for the patient with the fertility needs and with the adenomyosis. Our case study starts by this patient. Hers was 34 years old, and her first visit date was on May 27, 2022. Her chief complaint was amenorrhea for 7 weeks and repeated vaginal bleeding for 10 days. Reviewing her medical history, she has been experienced dysmenorrhea for 20 years, and the symptom getting worse over the past year. And she has been pregnant twice, had 1 C-section, had 1 miscarriage. And the ultrasound revealed a 20 by 25 by 24 cubic millimeter adenoma on the left uterine wall. And her last menstrual period was on February 28, 2022.
and starting experience repeating vaginal bleeding with lower abdominal dual pain from 5th week of pregnancy. The ultrasound revealed an intrauterine pregnancy with a single live fetus, and hypoechoic mass was found on the left uterine wall. The mass kept growing in size, and the symptoms kept worsening. Unfortunately, at the 13th week, she underwent abortion, and even after multiple medication, she's still abortion. That's his question. And after abortion, she started to taking Dynagest. However, after 3 months for Dynagest and 3 months for GHA, we can see the mass size is still insists. Then comes the question. The patient's adenomyoma raised, certain about her future well-being. Will she miscarriage again? And if she were to conceive for second time, what's the next step for her treatment? Let's pause for a moment and think about the clinical feature of the adenomyosis. The incidence rate of adenomyosis varies significantly depending on the study, demographic, and diagnostic criteria. For example, even symptomatic patient with the ultrasound has an incidence rate about 12%, while the symptomatic patient examined with MRI has the incidence rate about 33%. Even all the patients examined by the MRI, the symptomatic and asymptomatic group are different. And the adenomyosis is benign gynecological disease. There are some clinical symptoms: pelvic pain, abnormal uterine bleeding, short for AUB, reduced fertility, and they're also asymptomatic. And uterine fibroids and endometriosis are associated with disease of adenomyosis. And diagnostic methods of adenomyosis now replaced by imaging diagnosis, traditionally confirmed by the histopathological. Now, transvaginal ultrasound and MRI are commonly used. And the local high estrogen and efficiency progesterone antagonism are important parts of the TIR mechanism. Firstly, there are local high estrogen element of endometrium, and then inducing proliferation of smooth muscle cells and normal contractions that damage to the junction zone and initiates the tissue repair mechanism. And lastly, tissue repair process induces estrogen secretion. This forming a four-step cycle, repeat and repeat. Adenomyosis is chronic of inflammatory disease depend on estrogen, which determined by in situ endometrium. There are multiple pathological factors such as inflammatory factors, neurovascular formations, and fibrosis. So, inhibiting estrogen is the fundamental and the crucial treatment. Now, with this fact in mind, let's return to the case. We will start to discuss the comprehensive treatment of adenomyosis. Individualized plan need to be developed for patients with adenomyosis. Aspects we should to put under consideration includes age, fertility requirements, ovary reserve, the severity of the disease, and the disease tendencies. And the therapeutic purpose to achieve is relieve the pain, reduce bleeding, and improve fertility. There are multiple medications and surgeries, such as Gynaecology, COC, traditional high-dose progesterone, and Gynaecology. Also, there are laparoscopy surgery and HIFU. Nevertheless, only comprehensive treatment can produce the best outcomes to our patients. Okay, back to the case. Since medication have been not work and a surgery is a not good choice, so we decided to choose a HIFU. Before the operation, the MRI showed the adenomyoma location on the left and the front wall of the uterus here. And we take the operation on March 14, 2023. After the treatment, the contrast enhanced images showed a satisfactory absence of blood perfusion. The treatment total time about 34 minutes, and the urination time was 130 seconds, and the average power is about 3781, and the total energy was about 44,000 joule. And this is a high efficiency treatment with shorter time and low on energy. And after the treatment, we still let the patient continue to take Gynaecology for 3 months. After 3 months, the MRI examination shows the mass had shrunk significantly, and then the patient stopped the medicine to get pregnant. And at the same time, even with the medication, her dysmenorrhea was gone too. And fortunately, she got pregnant at the beginning of this year, and this time there was no bleeding or other symptoms. At the pregnancy of 13 weeks, the ultrasound showed a healthy fetus in the uterus and no other abnormal, and no pain, no bleeding. And this time, we think there will be a good future for this pregnant. And compared to last pregnant, I think this road will be a better ending. Okay. As Rudy professor said, we should open our mind. So there comes some thought about this patient. Should we start considering HIFU for patients even with small size adenomyosis? And according our observations, during the operation, the patient was able to be treated with the considerably less time and energy compared to the patient who did not take Gynaecology. Could it be that adenomyosis lesions pre-treated with medication are more sensitive to energy? Last but not least, how could adenomyosis patient with fertility needs benefit more from the use of HIFU? Now it's near to the ending of this presentation. It's a good time for me to introduce our micro and non-invasive team. I come from Guangdong Foshan, and our hospital has 143 years history, and our team, there are 18 members, includes 8 gynecologists, 4 surgeons, 6 nursing staff. All the doctors do not just perform HIFU treatment,
but also manage patients in their own department and perform gynecology and surgical procedure too. That's to say, HIFU has become one of our methods to manage disease in our own discipline. Okay, some of the above talk about adenomyosis is a complex syndrome characterized by an estrogen-dependent chronic inflammatory process. And also pay attention to the comprehensive treatment of patients with adenomyosis, which requires precise and individualized long-term management. And lastly, we propose for patients with adenomyosis who have fertility needs, reasonably choosing focused ultrasound obligation for pre-treatment can bring more benefits. Every doctor should remember that treatment makes patients less vulnerable. Oh, that's all for today. Thank you.
Very thankful for Dr. Liang. She told me our case report and shows the patient with uterine adenomyosis have very difficulty in success pregnancy. And the HIFU treatment for adenomyosis can be an effective option for women who deal fertility presentation, especially the comprehensive treatment with HIFU is a good choice for patients who desire to have a pregnancy. This again, thanks Professor Liang. Thank you.
Okay, it's my honor to introduce our next speaker, Dr. Jordi Rodriguez. Am I right? Dr. Jordi Rodriguez. He is the head of HIFU unit at the Mahkota University Hospital. 14 years of experience in the treatment of uterine fibroids and other benign pathologies with US-GAD HIFU. More than 1,000 procedures done between 2008 to 2024. 2019, board member of the ESG working group on non-surgical ablative therapy of benign uterus disease. 2020, president of the benign uterus pathology committee at the Teresa University Hospital. 2023, standing board member of the International Society of Minimally Invasive and Vitreous Surgery, peer review in several scientific journals, speakers at various courses and congresses in gynecological endoscopy surgery and ultrasound therapy, both national and international, both the publication of some articles. So welcome, Dr. John.
Thank you very much. Okay, first of all, thank you very much to the ISGE organization. Of course, thank you very much to Chongqing HIFU and Professor Wang, and thank you. Okay. When we speak about HIFU or uterine fibroids and pregnancy outcomes, it's impossible not to speak about some epidemiological facts. Principle, the age factor, okay? We all know that currently there is a tendency to delay childbearing beyond the age 32, mainly the Western countries, of course, and this situation combined with the increase of fibroids with age leads to us a new scenario, which is the large number of older patients with fibroids and problems conceiving, okay? Unfortunately, the advances in new reproductive technologies cannot compensate for this issue, and patients undergoing in vitro fertilization suffer from recurrent implantation failure or miscarriage. And of course, this is an important economic and of course, economic problem and social problem. Well, but focusing on uterine fibroids, you know, they may the sole cause of infertility in 1 to 3% of women and be the cause of 7% of recurrent miscarriage. Of course, submucosal fibroids of any size and intramural fibroids distorting the uterine cavity have the most negative impact on fertility, with low implantation pregnancy and delivery rates in comparison with women without fibroids. On the other hand, some authors support the idea that intramural fibroids greater than 4 centimeters, even without cavity distortion, may also impair fertility by different pathological mechanisms other than distortion of the uterine cavity, as the increased uterine contractility, the impairment of the endometrial and myometrial blood supply, chronic endometrial inflammation, etc., etc., etc. Moreover, uterine fibroids also increase the risk of pregnancy complications, you know, such as abnormal fetal position, premature rupture of membranes, and other problems during pregnancy and delivery, okay? And what else? Okay, what is the standard today? Currently, unfortunately, laparoscopic myomectomy is the standard treatment for patients with uterine fibroids who wish to conceive. However, in recent decades, less invasive treatment options have come available, one of them HIFU. And okay, you know, high intensity focused ultrasound is a non-invasive tumor ablation technique. Using a special transducer, the ultrasound wave passes from the skin and through different tissues and are focalized on a point deep in the abdomen, okay? And in the target organ, this leads to high temperatures between 60 and 100 degrees, resulting in necrosis in parts of the fibroid. And okay, as you can see in the images, the ablation is guided by real-time ultrasound. You can see, this is the images during treatment, okay? And this is the treatment. We make an ultrasound pre-scan on the sagittal view during different sections with 5 millimeter separations. And we start to treat the deepest area. You can see here changes, echographic changes, echogenic changes in the posterior zone, posterior area, okay? And we finish treating the shawlless areas, finally, the medium and finally the shawlless areas of the fibroid. We consider the treatment completed when we see hyperechogenic changes in the entire fibroid, indicating a complete ablation of the tumor. You can see here in these images, okay? Well, after HIFU treatment, the treated fibroid is absorbed by the tissue nearby, and the uterine structure and uterine cavity gradually return to normal. This is the intention, okay? Okay, this is very important. The main advantages of HIFU, you know, are, first thing, there is never bleeding or infection, never. This is a typical complications of conventional surgery, okay, but not with HIFU. Never bleeding, nor infection, okay? There is only mild postoperative pain. The procedure is done under constant sedation. All patients are discharged. All patients in our center, no patient, all patients are discharged between 3 and 5 hours after treatment. Patients have a faster recovery after HIFU compared to surgery. And very importantly, no skin or uterine rupture, or uterine scars, which is of special interest in women with gestational desire, of course. On the contrary, myomectomy has some comorbidities. Of course, a uterine scar with 1 year waiting time until pregnancy and the risk of uterine rupture, low risk, but with potentially various serious complications, okay? Well, how about the damage to the tissue nearby? Okay, Dr. Selva and Dr. Cheung has already speak about this before me, but okay, HIFU achieves ablation of uterine fibroids without damaging the surrounding myometrium. There is conservation of the biomechanical properties of the myometrium, and HIFU also seems to preserve ovarian and endometrial function. We have some studies, okay, that show no significant difference in the antimullerian hormonal levels before after treatment, and other studies, okay, about the molecular and tissue markers of endometrial receptivity, very, very important in vitro fertilization after HIFU, okay? Okay, in my opinion, the objectives of HIFU ablation of uterine fibroids in women with gestational desire are, on the one hand, to achieve the inactivation, this is my word, okay, the inactivation of the hormonal, vascular, inflammatory function of the fibroid, okay? And this, we achieve this first objective immediately after HIFU, okay? Thanks to the total necrosis of the fibroid. The same day, we don't have hormonal function, we don't have motility function of the fibroid because it is necrosed, okay? It's very important. The second objective, of course, is to shrink the fibroid in order to normalize the uterine anatomy, especially important in some mucosal fibroids, but it's not necessary in small intramural, not distorting fibroids. It's important in some mucosal fibers, of course, to achieve this second objective, okay? But both things seek to increase the chances of obtaining a safe pregnancy without the complications of surgery. Okay, logically, the greater the ablation of the fibroid, the greater its shrinkage during follow-up, of course. Okay. We have, okay, all the experience and all the most important experience and evidence in pregnancy outcomes after HIFU comes from Asia, of course, from China. But over the last few years, several studies have shown the safety and efficacy of HIFU treatment for patients with uterine fibroids who intended to conceive. Large series, 130 pregnancy after HIFU, large series with high gestation rates, obtaining full-term pregnancies with a normal delivery, with few complications and with no cases of uterine rupture. Okay, nowadays there is one case of uterine rupture, only one case after HIFU, okay? Or abnormal presentation, okay. Based on the data currently available, pregnancy outcomes after HIFU appear non-inferior to myomectomy. Both improve the pregnancy outcomes, live birth and miscarriage rate, similar perinatal complication rate. Obviously, HIFU technique has some differentiating advantages, such fewer complications, shorter hospital stay, lower postoperative pain, faster recovery, very important, shorter pregnancy interval in comparison with surgical treatment. Our experience is not so much different from all these publications. In our retrospective study, we included 560 women with symptomatic uterine fibroids who underwent ultrasound guide HIFU between 2008 and 2018. And okay, 71 pregnancies of 55 patients have been obtained. The pregnancy rate was 34%, which is similar to other treatments. Among the 71 pregnancies, there were 43 successful deliveries, including a natural twin gestation, with an incidence of cesarean section of 43%, which was much lower than in patients undergoing myomectomy and embolization. In relation to the 55 women who became pregnant, more than a half, 55%, were at least 36-year-old, very old patient, 36-year-old at the time of treatment. 80% of these women were nulliparous, and we must highlight that 33% had primary or secondary sterility, and 18% had at least one miscarriage before HIFU treatment. It's reasonable to think that HIFU could help to improve fertility in this type of patients. We have to demonstrate, of course. The rate in our series of preterm delivery was only 9%, which is lower than in series of pregnancies with untreated fibroids or pregnancies following embolization. The mean birth weight of the 44 newborns was 3 kilograms, and except for the 1.4 kilogram baby who was born with a previously diagnosed tetralogy of Fallot and intrauterine growth restriction, the remaining newborns, 98%, developed well without complications during postpartum and breastfeeding. These are the few complications detected during pregnancy. We can see only one preterm labor due to polyhydramnios. 2 cases of placenta previa, and 2 cases of premature rupture of membranes. And during delivery, 2 cases of emergency cesarean section, in 1 case for fetal bradycardia, and the second case for hemorrhage due to placenta previa. 3 retained placenta with manual removal in 1 case, and 1 case of severe preeclampsia. Okay, it should be noted, sorry, that there were no cases of uterine rupture or placenta accreta. And these results were achieved in women with a median maximum diameter of treated fibroids of 6.4 centimeters and a non-perfused volume of 76%, okay? Which is higher than that reported in some series. Okay, to date, the number of post-HIFU pregnancies has increased in our center, and currently about 80 women have achieved a total almost 100 pregnancies, of which 62% have ended in a successful delivery, okay? And the percentage of vaginal delivery is similar or higher than 62%, okay? And these are some cases from our series that successfully ended with 1 or 2 pregnancies. You can see a 34-year-old woman with a non-perfused volume, okay, of 100% of the volume, okay, very good results. Okay, we have 2 different patients, okay, here we can see this fibroid in the posterior wall of the uterus, okay, total necrosis, 100% of the necrosis, and in the other case the same, 2 fibroids, a small fibroid, a small size, and this other fibroid, completely abraded with good pregnancy results. And okay, 2 more cases, okay. Probably in this case, the non-perfused volume is near to 80%, which was enough to achieve a pregnancy, okay. In the other cases, 100%, okay. Okay, very interesting case. It's a huge fibroid. This is 9 centimeters, okay, transmural fibroid. Probably 95% of the non-perfused volume, okay. The fibroid decreased after HIFU, shrunk, and okay, this woman obtaining a full pregnancy 10 months after HIFU with a vaginal delivery. This is a submucosal fibroid type 0, okay, occupying the entire cavity, type 0, okay, completely abraded, and disappears 6 months later, sorry, no. Okay, here, completely disappears 6 months later. Here, sorry. Okay. And 2 months later, after this MRI, the patients achieved the first pregnancy and second pregnancy with vaginal delivery with no healthy babies, okay? Okay, in type 0, the standard treatment is hysteroscopic resection, but in big fibroids, it's very difficult to achieve success with hysteroscopic resection, okay? And we have this publication, ultrasound guide HIFU is safer and more effective than hysteroscopic myomectomy in the treatment of symptomatic submucosal fibroids larger than 5 centimeters, okay? And we can do HIFU alone or HIFU and 3-6 months later hysteroscopic resection with a small fibroid, okay? We can combine both treatments. This is a very interesting case of our series, a transmural fibroid successfully treated with HIFU and with hysteroscopic resection. This is an example of the remaining myoma fragment 6 months later, okay? First HIFU, 6 months later, hysteroscopic resection, and this is the hysteroscopic diagnosed, okay? Completely free of fibroid, okay? And 3 months after this diagnosed hysteroscopic, patient achieved a spontaneous pregnancy with vaginal delivery, 3 kilograms baby with no problem. Okay, we can treat cases of polymyomatosis with fibroids of different locations in the same patient. The submucosal fibroid that you see here, okay, you can see 3 fibroids. There are another 4 fibroids in the lateral wall. We cannot see here, but 4 fibroids, completely ablated. And this is the submucosal fibroid. You can see here the uterine cavity distorted by this fibroid, okay? And this fibroid completely disappeared 8 months after HIFU. And just at that moment, the patient underwent a successful in vitro fertilization and got a full-term pregnancy, okay? And the pregnancy ended in a cesarean section due to breech presentation. Okay, as a conclusions, of course, uterine fibroids can negatively affect fertility and increase the risk of specific pregnancy complications. Myomectomy has some disadvantages that we should consider, especially in women who have decided to conceive, very important. According to our experience, HIFU is an effective and safe treatment for uterine fibroids. And okay, we can achieve full-term pregnancies with a few intrapartum complications after HIFU treatment. Is a good treatment for patients who desire conceive, okay? And due to its non-invasive nature, HIFU could be the first therapeutic option. In our center, is the first option for women with fibroids who wants to get pregnant, okay? To get pregnant. And okay, with many advantages over myomectomy, of course. And in some cases, HIFU could even improve fertility, but we have to demonstrate, and of course, with more and more studies in our center. Thank you very much. That's all. Thank you for your attention.
Okay, thank you. Thank you, Dr. Jordi. So we all know the uterine fibroids is the most common gynecological tumors. So this study from Dr. Jordi and his partners told us that the HIFU is a safe and effective treatment for the different type of fibroids, submucous fibroids, intramural fibroids, and multiple fibroids, especially for the women with birth requests. So great research. Thank you, Mr. Jordi. Okay, let me introduce our next speaker, Dr. Zhu Xiaogang. Xiaogang is an attending physician in the Gynecological Department of the 3rd Xiangya Hospital, a member of the Clinical Research and Quality Control Professional Group, a member of the Focused Ultrasound Ablation Therapy Group of the Ultrasound Therapy and the Biological Effects Professional Committees, mainly researched in minimally invasive and non-invasive gynecological treatments since 2012. He has independently managed more than 5,000 cases of HIFU treatment for benign gynecological diseases, hosted or participated in 4 scientific research projects, obtained 8 patents, and received 4 provincial and departmental level scientific research achievements, published more than 10 papers, including 6 SCI papers. Okay, welcome, Xiaogang.
Thank you. Thank you very much for my old friend, Dr. Hao. I remember the good journey when I went to Spain in 2015. It was very good and very good memory. I still remember it. So today, my topic is focused ultrasound ablation for the treatment of postpartum placenta inquitor and subsequent pregnancy outcomes. I come from Central South University and the 3rd Xiangya Hospital. HIFU is also called focused ultrasound ablation. Dr. Lang called this focused ultrasound ablation is Chinese technology, Chinese manufacturer, and Chinese brand and Chinese standard. This is a number of benign and malignant cases we finished in our hospital. Last Saturday, we just finished the 9,000 cases. And we finished about 306 cases of placenta inquiry. This is a definition of the placenta inquiry, and it can be classified into placenta inquiry, and placenta perculator. We must make sure when we write the article in the SCI or in the paper, because mainly publications before the doctors write placenta inquiry. No, placenta inquiry, in my opinion, it's no need for HIFU. Placenta inquiry is very good for HIFU. So a case, this is a 25 years old woman. She is admitted in our hospital in October 26, 2020. The chief complaint of here is vaginal bleeding after labor, induced labor and parentage for 1 month. On September 26, 2020, induced labor due to premature rupture of membranes, and the placenta was not detached. Manual removal of the placenta under ultrasound, and the vaginal bleeding is more than 1,020 millimeters. So all the drugs and the Chinese traditional medicine was used for 1 week. On October 16th, our ultrasound found mixed mass C in the upper and middle segment of uterine cavity, measuring 59 multiple 50 millimeter with unclear boundary with the uterine and the posterior wall. So there is no significant past medical history, personal history, and family history, and her menstrual history. There is no significant normal. But marital history is gravid 2, pregnancy 1, and abortion 1, and still have fertility desire in the future. So the normal body temperature, blood pressure is normal, and the vaginal examination, a small amount of bloody and odorless liquid in the vagina, and the uterus is enlarged to the size of 2 months of pregnancy, and the low tenderness on the uterus, and no obvious abnormalities are palpated in the bilateral anexa. The HCG is a little bit higher than the normal level. It's 80 units per millimeter. So another MRI is performed. An irregular mass was seen in the left uterine wall and the left wall of the uterus, with a range about 5.6 multiple 5.0 centimeter. This is the MRI picture before the HIFU treatment. We can see the left uterine hole, we can find about 5 millimeter placental tissue. And this is the enhanced MRI picture. We can see the blood supply in the placental tissue. The administration, according to the symptom, physical signs, and the examination, the administration diagnosis is postpartum placenta inquiry. There have many treatment methods for placenta inquiry: surgical treatment, interventional therapy, and drug therapy. So I think HIFU treatment is a new therapy. From 2011, there have been more than 10 articles published at home and abroad, including 300 cases of successful application of HIFU in the treatment of postpartum placenta inquiry. There have many advantages. Just Dr. Jordi said, non-invasive, non-radio, anti-pollution, and real-time monitoring. So it's a novel non-invasive therapy for placenta inquiry. HIFU and expectation treatment is used for this patient. On October 26, 2020, 2020, HIV treatment of placenta incubator was performed. Treatment time is 132 minutes, and the salutation time is 922 seconds. This is the picture before the HIV treatment. There we can see the ultrasound. Under ultrasound, there have blood flow in the placenta tissue. After the HIV treatment, the blood supply is disappeared. So the patient take 1 week of oral antibiotic drugs after the treatment and advised to follow up regularly in the outpatient department for expectation treatment. There was intermittent discharge of a small amount of pregnancy tissues without abdominal pain or vaginal bleeding. On March 7, 2021, about 4 months after treatment, MRI was performed, showed no obvious residue, and there were no significant change in her menstruation. Her last menstrual period was on April 10, 2022. She became pregnant naturally, and she got a cesarean section on January 10, 2023. There was a small amount of placenta residue during the surgery. This is the picture 4 months later, 4 months after the HIV treatment. The placenta incubator tissue is disappeared totally. The perioperative management and the scales of focused ultrasound ablation for this disease. First, the MRI and the ultrasound before the treatment is needed, and no active vaginal bleeding. The vaginal bleeding must less than the normal menstruation, and whether the body temperature is high, because we must exclude the acute inflammation disease. And pay more attention to the focus point during the HIV treatment. Keep the distance of 1 point, at least 1.5 centimeter between the serosome layer, and avoid excessive ablation damage to the uterine surface. So, if there is no obvious infection and massive bleeding, it is suggested that no carotid after HIV treatment. Follow up 1 to 3 months after treatment, waiting for the natural discharge of the lesion. It is important to actively prevent infection for 7 days. And the drug for promoting uterine constriction, such as Chinese traditional medicine or estrogen, can be given orally to promote the discharge of the retained pregnancy tissues. And monthly checked up the blood routine, color Doppler, ultrasound or MRI, and other examination. If it not discharged for more than 3 months, it can be further treated. It can be further treated by hysteroscopy. And there are the outcomes, the pregnancy outcomes of this disease after HIV treatment. There are 2 reports on the outcome of subsequent pregnancy after HIV. The first one is they treated for more than 40 cases, and 18 patients have future reproductive plans, and 7 of this patient became pregnant and delivered and full term. And another literature reported that they treated 95 cases, and 9 patients were delivered and full term. And in our hospital, there were 70 patients have fertility desire after HIV treatment, and 30 of them became pregnant, and last 40 patients delivered and full term. 3 of them have placenta incubator this time. Maybe more data are needed to confirm its impact on the endometrium and subsequent pregnancy outcomes. As a new therapy, HIFU has been proved to be safe and effective in the treatment of postpartum placenta inquiry. For patients who want to who have fertility requirement, there are small amount of patients on the outcome of subsequent pregnancy after HIFU treatment. Maybe more data are needed to confirm its impact on the endometrium and subsequent pregnancy outcomes. That's all. Thanks for your attention. Thank you.
Okay. Thanks, Xiaogang, for his sharing and the nice case report. We know that postpartum placental inquiry does really serious harm to women's health. In this case report, the PPI was cured by the HIFU with no hysteroscopy, no dilation, and curettage, but the endometrium was protected perfectly. So it makes sense in clinic. Hopefully, HIFU will get good achievement in the future. So it's the question and answer sessions.
Hello everyone, I'm from Prague, Czech Republic, from Charles University. I have one question for Professor Rudy. This was perfect lecture, thank you very much, very nice. I want to ask you, I have seen your study, a single site study about HIFU, and in the second or third site after was comparing the laparotomy, laparoscopy, and the hysteroscopy had a rate, I think, about 6-8% there. This is your expertise. This is from your side, or this is from some studies comparing this percentage?
Sorry, comparing this percentage? Sorry.
No, you have compared laparotomy, laparoscopy, and hysteroscopy.
There are some studies comparing this.
Yeah. This was from study. There's some from study. And do you know which criteria, for example, for this hysteroscopy has been? I ask you because I think it's a low range, this 6-8%. I think this must be much more. And if you know the criteria for for inclusion to this study.
Gosh, I'm sorry. You haven't understand this guy? Sorry. Apologize for my English, but I don't understand the question. Sorry. I understand there are some studies about comparing these different types of surgery. Okay, but the question.
My question is because you have compared 3 kinds of surgeries.
No, my experience.
Know your experience.
You have
to know your experience. And there was laparoscopy, yes, and there was the hysteroscopy. And hysteroscopy has the smallest, this has only 6-8%.
6-8%?
6-8%. And I ask which criteria?
6 to of what? 6-8% of what?
Of fertility outcomes. Of fertility outcomes.
You don't say.
Your presentation was about the fertility outcomes. So
there are other things.
This was for fertility outcomes.
6 to 7% of
hysteroscopic myomectomy. And I ask you which criteria was for including the women to have this hysteroscopic arm, because I think that this is low percentage.
Yeah. Okay. The indication for hysteroscopic myomectomy, okay, in submucosal fibroids, probably is the first indication in women with this gestational desire, of course, okay? But my opinion is, okay, HIFU therapy is a non-invasive technique, is very safe. And if the HIFU treatment doesn't work, it's no problem. You can do after HIFU hysteroscopic resection, but okay, hysteroscopic resection is aggressive, okay, it's an invasive procedure, minimal invasive, of course, but you can do adhesions after hysteroscopic resection, okay? And probably in fibroids bigger than 5 centimeters, HIFU treatment is better because you can ablate the total volume of the fibroid, and you can do HIFU alone to ablate the fibroid and disappear. And after this, the time to conceive is very short. But okay, and for me, okay, in fibroids with 1-2 centimeters, probably hysteroscopic resection is the standard treatment, of course. But 3 centimeters, 4 centimeters, 5 centimeters, HIFU is the first indication, okay? And this is my idea. In patients with gestational desire, it's very important not to damage. And HIFU, we have to demonstrate and to have more evidence, but it's very non-invasive technique, okay? And very important for these patients. I hope I understand. I answer your question. Sorry, it's similar. Yeah, okay. We can speak after this.
Dr. Selva, I have a question for you. What changes in the endometrium could be proven histologically? Did you ever did biopsies of the endometrium to show that HIFU harms or doesn't harm the endometrium? And what were the changes in the increase in lymphocytes, or didn't you do that? You know what I mean?
I know. I didn't do that. That's one study that both Jordi and I showed. They actually took samples from the endometrium.
Okay.
They looked at it under electron microscope.
Okay.
I mean, they look at many things, pinopods, all kinds of things, and recorded it, and then checked it after HIFU and recorded it, and they found that there's no changes. So that's the only clinical evidence we have that HIFU does not change the anatomical structure of the endometrium. That's all I can tell you.
Yeah. Is that also?
They did electron microscope. They looked at it under electron microscope. Yeah.
Is that also your?
Yes.
Yeah.
It's the same paper. It's only one paper.
Who did that study?
No.
Oh, you can tell it me later. Yeah. Thank you very much.
You do it. Did you do it? Did you? Oh, okay.
I don't know why. We need more studies, of course. But my question is, when we are treating, for example, adenomyosis, and you look the MRI after HIFU, if these images are excellent treatments of Professor Selva, and you can see the total necrosis of the entire wall. But finally, 3 months later, you will see another time a normal myometrium. Is it myometrium? Normal myometrium with MRI. Yeah. With contrast 3 months after HIFU. Yeah. And that's because probably the total necrosis, the permanent necrosis is from the fibers of endometriosis, of the adenomyosis, sorry, but not from the fibers of normal myometrium. I don't know why, but the total wall is black, okay? And 3 months later, is perfused another time with no adenomyosis. I don't know why, but the normal fibers of myometrium are preserved. We have to demonstrate probably with samples, with biopsy, but
is that also your observation?
The normal tissue disappear and the normal tissue appear newly. Sorry.
Also, we use the ultrasound and check the blood perfusion and the contraction wave of the uterus and the cavity of the uterus, and compare before the HIFU and after HIFU, 1 month, 3 months, about like the endometriosis. Adenomyosis. Now we observe about 15 patients. That is no different. That's the same. So I think we think the HIFU don't influence the endometrium. Okay, endometrium.
Can I ask maybe the last question for this session? I want to ask for the Jordi and also Xiaogang. I think Xiaogang gave a very good presentation about the placenta accurata. I want to know whether in Spain, Jordi's HIFU center, you have done this indication before or not, and what's your opinion about after the HIFU treatment? Do you think we need to move out the ablated tissue by the doctors or just let it go? And maybe Xiaogang can give some detailed explanation of your opinion. Thank you.
Okay, I have a short experience in this issue. I have only treated one case, but this is a specific case. It's a entirely total retained placenta after a normal delivery. Okay, and okay, first time because we don't have experience, patient decide to leave the placenta inside and wait a time. Okay, but 1 month later, the placenta inside with the same size, and finally we offer HIFU treatment. Okay, with it, we achieved a total hyperechogenic changes, total changes in the placenta, and the MRI after HIFU, total necrosis of the placenta, and okay, 1 week later, the patient expelled one fragment. 2 weeks later, expelled another second fragment. 3 weeks and 4 weeks, and 4 weeks later, expelled the total necrosis, the total placenta, entire placenta was expelled. Okay, and 1 year later, achieved the first pregnancy, spontaneous pregnancy with vaginal delivery, and second pregnancy which ended the same with vaginal delivery. Only one case, important case, and in my opinion, because some people in my service said, okay, you have achieved a complete ablation, okay, we have not to wait. We can do a hysteroscopic resection, but not. Finally, we wait, and 1 month later, total explosion. Okay, it was very easy to treat with a low energy, okay, carefully with the boundaries, okay, because it was easier to ablate this placenta. But my opinion is we can try it in these cases because it's very safe for fibroids, it's very safe for placenta, okay? Sorry.
Thanks for the question. It's a very good question because before 2020, in our hospital, all the placenta increator after HIFU treatment, we do hysteroscopy. So we analyze this all data about 200 patients. About 40% of patients they have two hysteroscopy. Yeah, they must only 60% patient can remove all the placenta tissue one time. Then the last 40% patient they have another surgery. Yeah. So this year we found expectation treatment is very good for this patient after HIFU treatment. We just keep the placenta tissue in studio. And almost 80 to 90% of this patient, all the placenta tissue can discharge itself without any other surgery. Maybe 10 to 20% people they need another hysteroscopy. I think it's better for this patient. Not only for the economic, but also for the for her endometrium. Because I just say the pregnancy outcomes, I found that there are two groups. Only HIFU treatment group they have a higher pregnancy rate after after the treatment. And if a patient she suffered HIFU and hysteroscopy, the pregnancy rate lower because every time we do the uterine surgery, her endometrium may destroy it, and following the intrauterine adhesion occurred. So I think expectation treatment is better for this patient. Thank you.
Okay, time goes late, so thanks our experts. Welcome our moderators for next sessions. Cheung Jie, Xiao Lixin, Wang Yanzhou. Welcome.
我们还是注意一下时间哈。
套下来听。那我们开始下一个环节的这个演讲。我先介绍一下主持人肖立新教授。
Let me introduce to you moderators, Mr. Professor Xiao, Director of Breast Surgery, Hunan Maternal and Child Health Hospital. Welcome. Introduce to you Professor Wang Yanzhou, Deputy Director of the Department of Obstetrics and Gynecology of the first affiliated hospital of Medical University, Director of the Department of Gynecology, Doctoral Tutor, Visiting Scholar of Wilde Medical College. I introduce to you Professor Cheung, Doctor of Medicine, Chief Physician. I catch some time to give more time to our presenter. The first one is Professor Xu from, he is a Vice Director of the Department of Gynecology, Director of Selva, Peking University, Peking Hospital, Zhibiao Hospital. She has many posts in different organizations. He has rich experience now. He will talk about clinical treatment of high intensity focused ultrasound in cesarean scar pregnancy. 非常感谢大家的介绍，大家下午好。我今天下午要讲的就是HIFU在剖腹产瘢痕妊娠中的临床治疗。我有4部分要先讲，第一个就是疾病的特征，第二个 CSP 的诊治现状。
Reduced cesarean section. About CSP typing, up to now there is no recognized optimal CSP typing method, and the CSP classification mentioned in the 2016 census is the first choice in the clinical practice, which divided into 3 types. The cause of the CSP is number 1 is the history of the uterine surgery. Second is the poor healing of the previous cesarean section incision. And the third one is inflammation, and the last one is retroflexion of the uterus. It's an independent risk factor of CSP. The disease characteristics of CSP, the incidence of CSP is about 0.5 per thousand. And the lack of public awareness, patients difficult to understand or accept ectopic pregnancy at specific sites. Even blame the doctor who conduct the cesarean section for its occurrence. Now the last one is an important one, is risk, high risk, hemorrhage, uterine perforation, placenta aggregata, hysterectomy, and even vaginal dies could be happen.
The incidence is on the rise due to the increased cesarean section rates and improved diagnostic techniques, improved disease awareness, and the changes in the surgical sutures, as well as in our China, the implementation of the two-child and three-child policy. The second part is current status of diagnosis and treatment of CSP. Now, ultrasound is the first choice because it's convenience and economical. Then contrast enhanced ultrasound rarely used because when we can't confirm the CSP, use the ultrasound. We use the MRI examination. MRI can clearly show the relationship between the gestational sac and the uterus and its surrounding organs in the lower part of the anterior wall of the uterus. However, the cost is more expensive. About the treatment of CSP, clinically, anti-mifestrone and open entrance for vaginal surgery and Apolikhina and the ultrasound as curettage, included under HIFU, can be used alone in combination. But the Society for Maternal Fetal Medicine indicates that suggests curatives will not suggest to be used alone. There are many treatment modalities and lack of uniform standards, but the principle of this treatment is early diagnosis, early termination, and early clearance. Near-term attention on avoiding serious complications, long-term focus on the fertility protection. Now, we focus on the third part, application and the progress of HIFU in the treatment of CSP. High-intensity focused ultrasound is also called focused ultrasound ablation surgery, commonly known as HIFU knife. The principle of this technique I will not repeat here. The principle and the purpose of HIFU pre-treatment is the first angiogenesis at the implantation site of embryo, degeneration and coagulated and necrosis. The second is destroy the blood vessel and with a diameter of less than 2 millimeters and effectively reduce the blood flow perfusion of the gestational sac at the scalp. Then the gestational sac and the uterus scar are easy to be peeled off. Finally, reduce the risk, massive bleeding, and protect the fertility. Now, we review some research demonstrates that the effectiveness of HIFU in the treatment of CSP. The study one is the third Shanghai hospital took the lead in the clinical exploration and summarized 53 cases of CSP treated with HIFU before curettage in 2015. The median blood loss of curettage was 20 milliliters, which preliminary proved that HIFU combined with curettage could safely and effectively treat scalp pregnancy within 8 weeks of pregnancy. Now, this is a retrospect study, and the patients will not be classified. The study 2 in 2018, also this hospital summarized the 367 CSP cases of HIFU treatment, but this time they classified the cases into the 3 types according to the concerns of China experts. We got the conclusion that HIFU combined with hysteroscopic vacuum aspiration is effective in the treatment of type 1 and type 2 CSP. Now, it's here, and we have no time to get all the detail. Now, we look at the study 3. It's also a retrospective analysis of the treatment of CSP by HIFU, UAE, and surgery. Now, we take the 3 groups compared. We got the results that the treatment of cesarean scar practice by traditional operation UAE and HIFU were proved to be effective, but there were differences in the basic conditions of 3 groups of patients, including menopause time, gestational size, and the HCG level. The last study is about outcome of HIFU and UAE in the treatment of and management of CSP. From the table, we can see that HIFU group and UAE group, there was no significant difference in the basic condition of the patients. But from this table, we can see that the intraoperative blood loss, post-operative general bleeding time, and adverse reaction in the HIFU group were significantly lower than those in the UAE group. The conclusion is that QTH combined with UAE or HIFU for the treatment of CSP is effective. For patients with fertility desire, focused ultrasound ablation therapy is better than UAE. Now, this picture is UAE vs HIFU. UAE reduced the overall blood supply of the uterine, severe post-operative pain, and risk of ambulance shedding, risk of impairment of ovarian and endometrial function, and with irradiation. But HIFU, only the implantation site of the gestational sac was ablated to reduce the local blood supply, and the post-operative pain was mild and the complication was less, does not affect the ovarian function and the growth of the endometrium, and important is no radiation. Now, in the last part, I'd like to share 2 cases. The case 1 is type 3 CSP. The size of the gestational sac, the maximum longitude was 2.3 centimeters. The gestational sac was completely implanted in the layer of the uterine and with a severe scar. The thickness of the margin is less than 3 millimeters, and the distribution of the blood flow is broad. Take the implantation site of the gestational sac as the energy target of HIFU. Reduce the blood supply of the implantation site of the gestational sac so as to achieve the purpose of reducing intraoperative bleeding. This picture, you can see that this is after HIFU irradiation for 400 seconds. The blood supply of the implantation site of the gestational sac was significantly reduced after HIFU. Okay. Hysteroscopic QTH was performed on the first day after focused ultrasound ablation with 15 millimeters intraoperative bleeding. The first picture is hysteroscopy after HIFU, and figure 1 and figure 2 is after hysteroscopy. Now, look at the case 2 is placenta aggregate after induced labor in CSP of type 3. The sepsis QTH was performed after induced labor due to fetus malformation at 12 weeks of gestation. Uterine artery embolization was performed for massive bleeding during the operation. 20 days after operation, ultrasound showed that the size of residual placental tissue in the lower part of the anterior wall of uterus was about 5 centimeters. Hysteroscopy and QTH under ultrasound gains was performed. Then massive bleeding occurred again during the operation. Uterine cavity compression balloon was given to stop the bleeding. Transferred to our hospital for further treatment. In our hospital, we gave the patient HIFU treatment. During the treatment, the fluid in the uterine compression balloon is reduced when the ablation is performed. After ablation, the blue was withdrawn, we found there is no activity bleeding. Look at the picture. Look at the picture on the right. Yeah, the blue is gone, and the blood flow is gone, and the entire lesion was ablated. This is pre-operative and post-operative MRI. This one is in low signal area, is no blood distribution, and the entire lesion was ablated. Hysteroscopy cases were performed 1 month after HIFU, and intraoperative blood loss was 20 millimeters. MRI was performed 2 months after HIFU. Yeah, we count the uterine return to normal without residue lesion, and we still found the defect in the cesarean scar. Ultrasound 15 months after HIFU showed that intrauterine early pregnancy, possible embryo arrest. Retrospective management. Number 1, on the first day after hysteroscopy, the patients were discharged from hospital, and the blood ECG was monitored once a week. And the blood ECG decreased to normal in 3 to 4 weeks. So number 2, for women without fertility desire, long-term and effective contraceptive methods are recommended. Number 3, for women with fertility desire, it is recommended to be pregnant after 6 months of cure. Common complication of HIFU for CSP. The most common complication is abdominal pain and sacrococcygeal region pain. The second is the pain of the lower limbs, and the last one is hematuria. This is rarely happened. All of the complications is relieved in 3 days after symptomatic treatment. We make a summary. Number 1, focused ultrasound ablation is safe and effective in the treatment of cesarean scar pregnancy, but long-term and large sample clinical control studies are still needed. Number 2, the second of the treatment modalities should be based on the full assessment of the patient's condition before operation. They emphasize on the application of MRI examination in the diagnosis and the treatment of high-risk CSP patients, and selecting safe, effective, patient-oriented treatment modalities with less harm. That's all my report. Thank you for your attention.
非常感谢徐峰教授给我们带来这个。
Thank you. For the HIFU in the clinical treatment of cesarean scar pregnancy, especially for category 3, to reduce bleeding and the section of the substance, there is some advantages, but it should be done in combination with other measures to treat CSP. Thank you once again, Mr. Xu. Well, for the previous 3 hours, we learned the application of HIFU in uterus and the treatment in fibrosis and adenomyosis. For the next 15, let's switch the topic to know about how HIFU is used in women's breast treatment, and especially the treatment for breast fibroadenoma. And I would like to invite to stage Professor Chen Maoshan. He is Vice Director and Physician of Department of Breast and Thyroid Surgery, Shuiying Center Hospital. His topic is clinical research and application of HIFU treatment for breast fibroadenoma.
Thank you very much for your introduction. Here, and good afternoon, everyone. I'm come from Suimin Central Hospital, Sichuan Province of China. Here, it's my great honor here to share the clinical research and application of health treatment for the breast fibroadenoma. Yes, we know the breast is a special organ for a woman. If a breast get a disease, it's very sad thing. So we can see so many kinds of disease in the breast. We can see the breast benign tumor, breast cancer, and other disease. In our center, we can see the main disease of our breast cancer patients. But we can see the breast fibroadenoma is the most common disease. It's accounted to 60%. So for the common disease, a study from China, this study have involved 11,000 health population using the ultrasound and pathology to confirm the breast disease. You can see the breast fibroadenoma is up to 27% of the health population. Of the patients, 33% of the patients has the mild disease. So we can see the breast fibroadenoma is very popular and common in the young women. How to manage this disease? In the world, some several guidelines and consensus may get the proper clinical practice. From the American Society of Breast Surgeons, they suggested don't routinely surgically excise biopsy proved fibroadenomas that are smaller than 2 centimeters in size. And also, here are 2 guidelines in China. Here, we usually follow the guideline in China. We will do the surgery or selection the observation. Usually, patients with a big tumor or grows faster maybe will consider the surgery. And also, some patients, if the tumor with some risk of cancer, we will do the surgery. And also, if a patient selected to observation, we will usually doing the imaging examination to monitor the tumor changing. And also, if the patient have older age, we will do the breast cancer screening. So it's a very hard thing for some patients to do this way. For example, young women without any specific breast cancer risk, we will do the biopsy, we will do the regular imaging, and sometimes we will do the breast cancer screening and other cost. Maybe the fame of the cost is not known. But also, if a tumor in my breast, we may have a mean stress. Some patients will go to see one doctor and another, and maybe go to one hospital and another hospital. Sometimes this stress maybe have negative impact for the patient. So I want to see observation is maybe not a best choice for every patient. So now the invasive method we need to treatment and control the tumor for patients with breast fibroadenoma. And focused ultrasound ablation surgery, FUS, maybe is a good way, and HEF is one of the best way we usually use. And the international FUS guideline, we can see the breast tumor, breast benign tumor, breast malignant tumor is suitable for this ways to treatment. In China, The application of HEF used for the breast cancer and breast benign tumor has a very long history. We can see there are several guidelines, standard and consensus for the management of breast HEF use. Here is the mechanism of the HEF treatment for breast tumors. From the picture and the video, we can see the main mechanism is the head effect, cavitation effect, and mechanical effect. Is also seen they have in other disease. In our center, we have a long history using the HEF equipment to treat breast tumors. But now I want to see the HEF breast specific equipment is the new machine we can use to treatment breast tumors. This machine is approved last year, and we do some clinical studies for the approval. And also we buy the first machine in the world, and now so many experts from all over the world come to our hospital, our center to rate this operating. And before this approval, we do two-stage study to evaluate the safety and the efficiency. Stage 1, we use the pathological method to evaluate the HEF treatment efficiency. Every tumor will do a surgery after the HEF treatment, and the stage 2, we do not do the surgery, and we only using the imaging method to monitor the tumor changing. Now, here shows the machine is a breast-specific equipment, and here is the position when the patient is doing the treatment. When I located the tumor, we were doing the treatment under the ultrasound. We can see the changing and they get the fully treated. Here, we can use the imaging method to evaluate the treatment effective. Contrast ultrasound and MRI. Before the treatment and after the treatment, we can see the picture is very obvious different. This is get out the purpose. And also, we do 21 tumors from 20 patients to evaluate the efficiency of the HEF treatment. We can see, compared with the tumors without HEF treatment, the tumor after the HEF treatment, the TBC and HE staining, the picture is obviously different. This shows that the tumor cell is dead. And also, we're using another way doing the same evaluation and DH staining, and get the same results. HEF treatment can induce the cancer cell death. Also, using the transmission emission microscope and the scanning electron microscope to see the cell substructure. Now, compare the tumor without HEF treatment. After the HEF treatment, the cell substructure is obviously destroyed. So I can see the HEF treatment have a very good efficiency. Here, up to now, we have treated 200 patients with 1,600 tumors in our center, and we have constructed a breast fibroma database HEF cohort, and we record all the data of our patient. This is my summary of our data. The average age is they are 13 years old, and the tumor is near 16 millimeters. And also, the treat time is near 9 minutes, so we can finish the treatment very fastly. With with the follow-up data, we can see after the treatment, the data shows the tumor become smaller and smaller and smaller, and some patients where the tumor will disappear. At the 12 months, the average tumor value reduction is about 72%. And of the total tumors, over 19% of the tumors have shocked. Yes, and at the 12 months, about 22 tumors were disappeared. The picture shows the results. Also, we are concerned with the safety. Yes, the non-safety is very good, and the pain is usually we are concerned. Intra-operation and after operation, the pain is very mild. And also, the complication rate is very low. We are also concerned with the skin burn. Now, in 2 cases, we have the skin burned. 1 cases, we have to do a surgery to remove the skin. And in other words, maybe make me have more confidence of the HIFU treatment because I can feel the enough energy we can take to the tumor. Here, we also compared the usually do method to do treatment the Beverly tumors. Here is the Beverly tumor in our center. Do the local treatment is divided into 3 groups. General operating groups and vacuum-assisted biopsy, and this is HIFU treatment. We are followed at the 3, 6, and 12 months to evaluate the quality of life and cosmesis. Beautiful. And also, here's economic evaluation. From this data, we can see the physical score is almost the same. There's no obvious difference. But the mental score is different. The HIFU treatment is obviously higher than the other 2 treatments. And also the beauty cosmesis. We can see the HIFU treatment is no skin. But not only the patient evaluation, but also the doctor evaluation. We can see the HIFU treatment is obviously better. Yes, we have compared the health economics. The cost of the open surgery group is least, is very small, and the fee of the cost between HIFU and the ABB groups are similar. But HIFU group treatment has advantages that the ABB for patients with multi-tumors. But also, in China, for the paralysis, maybe HIFU is good. Here is 2 typical cases. 1 case is the tumor disappeared after the treatment. And another one with a tumor in left with a tumor in right. But left tumor is disappeared and right tumor is shrunk but did not disappeared. So we want to know how the tumor become disappear and why some patients will not. We analysis the treatment model and between the analysis the association between the treatment model and the outcome. We conclude that the treatment model of HIFU is obviously associated with outcome. So I want to know how to do a better HIFU treatment. We want to know a new doctor how to become an experienced HIFU doctor. We use the data from 2 centers. We can see about after the theory, a therapeutic study, the practice training of about 16 to 65 tumors treatment, we will become an experienced doctor. So in our center, we have several doctors have finished this training. Yes, in the future, in our center, maybe I will do the collect the more data of the cohort. And also, we will investigate the treatment model and the outcome. And we are doing the radiomics and other method of the tumor features between the treatment and the features. And also we want to find out the best suitable patient and the best protocols, process, and techniques. And also this is our work supported by this project. Here is my summary. I think everyone is know HIFU is a good way to treat tumors and many diseases, and also is an effective and efficiency and safety way to treat breast tumors. And in other words, I want to say maybe for a surgeon, we usually do surgery, cut every tumors. But I want to change my treatment concept. Maybe breast fibroadenoma, I want to control this disease. Here is my share my experience. Thank you very much.
非常感谢我们的陈木山教授啊，他是将我们
Thank you, Mr. Cheung. He talks about the experience and practices of application of HIFU in treatment for breast fibroadenoma. For breast fibroadenoma, the main treatment is open surgery. I believe HIFU is a future trend. Thank you, Mr. Cheung.
Next speaker is Dr. Feng Gang. Feng Gang is is the director of the Oncology Department of Mianyang Hospital. Welcome, Dr. Feng.
Thanks for the introduction for me. It's my great pleasure to introduce our college work here. I think I'm the only one to talk about malignant tumor here, so I think maybe I speak in my mother language in more clear, and the translator is much better than me. So next I will speak in Chinese. Thank you.
I'm a doctor of tumor department and have been doing treatment or chemical treatment, targeted treatment for tumor patients. In 2021, our department approved HIFU. Starting from then, we started using HIFU in treating malignant tumors. So today, I will talk about 4 parts. So first, dealing history of HIFU treatment for malignant tumors in our hospital. Actually, as I said, in February 29, HIFU Center was established, and the first JC200D was put into use to treat benign gynecological tumors such as uterine fibroids and adenomyosis. And in August 2020, the second HIFU comprehensive machine was installed to carry out HIFU treatment for malignant tumors. As of January 2024, HIFU has treated 246 cases of malignant tumors. From the table, you can see the different type of tumor patients that have received HIFU treatment. I want to introduce to talk about 2 patients and we visit and have follow-up visit to our patients. We have seen the shrinking of tumors and their outer treatment conditions. I think I will skip the principle of HIFU. And as a doctor of radiotherapy, and actually HIFU is similar to the tools we use in radiotherapy, such as I will skip this part too, and I have 3 cases for you. The case one is a female, 53 years old, with intrahepatic cholangiocarcinoma with ovarian metastasis. In October 2023, we did chemotherapy for him. We controlled her symptom, and in 2024, we tried HIFU for her liver lesions. In April 2024, we use HIFU for right ovarian metastatic lesion. We can look at the condition before and after using HIFU. The tumor was not well controlled, and because we can see some lumps. After using HIFU treatment, we can see the blood supply is reduced, and we can see the tumor necrosis after HIFU in liver lesions. And after chemotherapy, the tumor conditions, cold tumor indexes have reduced. But after using HIFU, the tumor necrosis and some parameters have been reduced. So it is very happy for us to and actually it is surprising for us to see there is such a good recovery for a patient with intrahepatic cholangiocarcinoma. And another case is female with ovarian cancer liver metastasis. We discovered the transfer of tumor to liver, and we did a 5 period of chemotherapy, but there is no good control of tumor development. And so we use HIFU for liver metastatic tumors. From March 2023 till now, there is no tumor recurrence. This shows the time of her treatment. And I have been doing chemotherapy for him from January 2023, but we didn't see a good improvement of her conditions. After using HIFU for treatment, we did a follow-up visit to her. We made several rounds of visit to her. We can see tumor are ablating. The last case is a very complicated case. She was confirmed with ovarian granulosa cell tumor in 2007, and there were several rounds of recurrence. So our child story from July 2022, it was a fifth recurrence, and we saw two big lesions of liver size, and in September we did radiotherapy for two lesions of liver size. In November we started the first half for the lesions, and in June 2023 we started a second half. Even though we know that this patient is used to radiotherapy and chemotherapy, and up till now there is no further recurrence of her tumor. This shows the fifth recurrence of her case. We saw a very big lump, and after chemotherapy there is no weakening of lesions, and we did radiotherapy for the two lesions in the liver. This slide shows our treatment plan, which is about 25 days radiotherapy on both her lesions. Maybe I don't know quite more about radiotherapy because liver cannot withstand many radiotherapy. But a big difference between HEF and radiotherapy is that HEF can target at the same lesion for multiple times of treatment. But we cannot use radiotherapy to do it for many times. So after 1 month after radiotherapy, even there is a shrinking of the lesion, but it is not a pleasing result. And therefore, we did the first half, including the big and smaller lesions, and the result is contact. 3 days after half, we use MRI. Even though we see some lump in the skin, but we see that the blood supply in both lesions have disappeared. So it means it is a good control. This shows another another thing that we have done 3 months after the first half, skin edema disappeared, major lesion tumors shown, and the tumor body did not enhance. But in a small lesion, there is a recurrence of blood supply, so there is a possibility of reoccurrence. Therefore, 7 months after the first half, when we feel the increasing size of the lesions, and there are some other bad conditions in the surrounding area of the lesion, we made a second half. So in the second half, we ablate the surrounding areas of lesion in the liver. So we use HEF to deal with 3 lesions. at one time.
在第二次海服后3个复查时，我们可以看
second half,
是沿着肝包膜外做了一部分走出去，可以看到那个强化膜已经明显的得到了控制。
the lesions have been controlled and there are less blood supply.
得到了一些控制。
This means the conditions was well controlled. In November 2023, about half a month after the half, about 6 months after the second half, all lesions continued to shrink without enhancement, and the patient did not experience any discomfort. Even though I talk about only 3 cases, but actually we have used a HIFU to treat about 300 malignant tumor cases, and I feel that there are some good characteristics of HIFU. First, HIFU is flexible and can treat single and multiple liver lesions simultaneous or at different times. So this is the first characteristics. Second, HIFU is repeatable and can treat a specific area multiple times while ensuring patient safety and treatment efficacy. And also, HIFU is a conformal and can achieve conformal ablation of tumors at a 3-dimensional level with minimal damage to normal tissues. So, as long as HIFU can be used to control tumors, we can accept it, and we don't have to exclude other ways of treatment, because I believe that no matter it is HIFU or other ways of treatment, as long as we can control the development of lesions, they are good ways. HIFU is comprehensive, and the tumors emphasize comprehensive treatment. So it is very good. We also use HIFU to treat patients of pancreatic cancer. It can be used to reduce pain, and even 20% of patients with pancreatic cancer do not use morphine anymore. And by using HIFU, it requires only 3 days of hospitalization, because HIFU does not cause any wound. And HIFU has advantages, especially in areas where ultrasound can reach tumors such as the liver, pancreas, kidneys, uterus, and ovaries. And HIFU is not expensive, with every affordable prices about 8,000 RMB for treatment, and we are doing some further researches. The first one is our completed research, which is reveal immunotherapy combined with low-intensity ultrasound and micro bubbles, a potential novel strategy for treatment of solid tumors. It proved that HIFU has the capability to treat this kind of disease. We also use HIFU in the area of chemotherapy, meaning that we are using HIFU to be used together with other ways of treatment. And by this kind of combined treatment, there are good changes for patients. It improves the immune system of patients. So we are doing some of these things. Thank you. We have received support for Chongqing Medical University of their work. Thank you very much. Thank you, Mr. Fang, for your excellent presentation. I think in malignant tumor treatment, which is the most difficult thing to treat, but you have achieved such a good result, which is very good. Now Q&A session. Now I would like to invite the 3 speakers to come onto stage to answer questions.
有什么问题吗？ Do you have any questions?
I would like to ask Professor Fang for cesarean scar pregnancy. Professor Fang, you mentioned in the end of your presentation that you would like to do, you think well-designed, randomized or case-control trial is very important for the management of cesarean scar pregnancy, right? What is in your mind in terms of that trial? Are you going to compare cesarean scar HIFU with curettage? What is your mind what are you going to compare with in your trial?
HIFU, the treatment of CSP HIFU, compared with what?
With what, yeah. When you are doing a trial, a randomized trial.
We can compare with the UAE.
UAE, right?
UAE, yeah.
Okay. Because you have already shown that UAE is not as superior as HIFU, right?
Yeah.
That is what you have presented. The reason I'm asking is because I'm not sure, it's always in my mind that there's a possibility that HIFU alone may do the work. In other words, there may be a proportion of patients that they actually do not need curettage. You see what I mean? So in that case, we never have studied that they use HIFU alone to treat cesarean scar pregnancy.
No, must combined with the curettage.
Yeah,
yes,
so
only HIFU is not.
What is your thoughts of doing a study that compare HIFU plus curettage and a study that HIFU alone in the treatment of cesarean scar pregnancy? What is your thoughts? Do you think it's too risky to do HIFU alone or because that has always been in my mind, because you never know whether HIFU itself will work for cesarean scar pregnancy?
Yes, we compared UAE and the HIFU, a comparison with curettage. We didn't consider use HIFU alone to cure the CSP because it's not effect. The HIFU, the principle of the purpose is stop the blood blue, stop the vessel under 2 millimeters.
Yeah.
Because if the vessels vessel is more than 20 millimeters, HIFU technique cannot make the vessel dice. So we never use HIFU the performance the CSP.
But you think it's worth just trying HIFU itself to see whether it works for CFP? Because the reason why I ask is because HIFU basically damages the pregnancies and let it die. And then it would generally resolve on its own. The reason why I ask is when we manage cesarean scar pregnancies, we do local methotrexate injection.
Yes,
methotrexate injection. And it works in 80-90% of cases. And the principle is the methotrexate kills the pregnancy.
Yes,
and then as time goes, it will gradually resolve on its own. The problem with it is it takes a long time for it to resolve, for the HCG to go down to normal. My thought is it possible that HIFU alone, there may be a small percentage or a percentage of cases that can resolve? And to answer these questions, because you never have answers, because there is only one paper in the literature that used HIFU alone to see whether CSP works. And it says it works, but it needs repeated dosage.
You can try it. You can, before HIFU, you can use MTX.
So what I'm thinking is whether it is worth doing a study comparing HIFU plus curettage, or HIFU alone, but delay the curettage for about a week to 2 weeks to see whether there's a response with HIFU alone, like significant drop of HCG before you proceed with curettage. And maybe after 2 weeks, some of them, the HCG drops a lot, and then you don't even need curettage.
I think this manner can be observed by a clinical doctor because HIFU alone, its risk is too high. The patients will unhappy because the performance only with HIFU. The risk hemorrhage could be happen. So we do not use HIFU alone. Sorry, I can't do that.
No, it's just a intellectual discussion. It's really no pressure.
Okay.
A question to Professor Chen Maoshan. In October last year, I was honored to visit your center for study. From 2019, you introduced the breast-specific HIFU equipment. Over 2,000 cases have been treated. So apart from used for the breast fibroadenoma, the equipment also treating the malignant tumors, cancers. Another disease, the inflammation of the breast. Have you ever tried HIFU treating the inflammation plus TCM? Thank you. So here are my experience for cancers. We are considering the guidelines and ethical standards and consideration from the patients. We will do some clinical studies, trials on stage 4 or stage 3, late stage. And for early stage, we do HIFU and then we cut the lesion out. If I have further data, I will report to you. The second is the chronic breast inflammation. So there are several trials. So one had a very severe response to anesthesia. So we were very cautious. We are doing it only as trial study. We do not have them in clinical practice. And thank you. With that, I would like to proceed to the next session. And I would like to invite the hosts, Zipin, Yang Xiaolin, and Zhao Yun to moderate the next session.
Running fast, so let me next section. Let me introduce Lex expect briefly. Lex expect is Zhang Hua, Professor Doctor of Medicine, Doctor Tutors. She is from Director of Obstetrics, First Affiliated Hospital, Chongqing Medical University. Please.
Thank you for Dr. Yang's introduction. Hello, everyone. Today, I will share the topic application of focused ultrasound in obstetrics. I'm Hua Zhang from the First Affiliated Hospital of Chongqing Medical University. So my presentation includes the 3 parts. The first one is introduction to focused ultrasound. So ultrasound is a mechanical wave with good penetration, focusing, and energy deposition. And the focused ultrasound can act on deep tissue by altering the microenvironment. And when we treat the soft tissue injury, so it can increase the target tissue temperature slightly and promote tissue healing. And when we treat tumor, so it can induce tumor tissue coagulative necrosis. So what's HIFE is high intensity focused ultrasound. HIFE motto is treatment, minimize harm to patients. As Dr. William Oster said, disease that harms the human body require less harmful treatment. So the focused therapeutic focused ultrasound has wide applications, include different tumors, cancers, even include some autoimmune disease, for example, osteoarthritis. So a total of 126 independent indications for therapeutic focused ultrasound have been approved and are being used in clinical practice. So HIFE is Chinese origin. By the end of 2022, HIFE Medical has obtained a total of 165 foreign patents and more than 400 domestic patents, and it has been exported to 31 countries and regions for clinical treatment. So the part 2 is the clinical application of focused ultrasound in obstetrics. So these 3 devices are main production in obstetrics. The high-intensity focused ultrasound treatment system is for placenta accreta treatment. And the other 2 devices is low-intensity focused ultrasound device. This one is for promote uterine involution, and this one is for relieve soft tissue pain. As we know, during pregnancy, because of congestion and edema, will induce pregnant feel the perinatal woman feels ligament and soft tissue pain. So in summary, in clinical application of focused ultrasound in obstetrics, one is high-intensity focused ultrasound HIFE. Another one is low-intensity focused ultrasound LIFE. So first one, as some doctors discussed before, HIFE treatment for postpartum placenta accreta. So placenta accreta is a serious complication in obstetrics. So it is a main cause of postpartum hemorrhage. Now we treat this disease always by drugs and some operations. For example, uterine artery embolization, uterine balloon, tamponade, and so on. Even at last, we have to do hysterectomy. So now we try our best to find a less invasive, more efficient and safe treatment method. So we explore focused ultrasound ablation surgery from solid tumor to placenta accreta. So using the great penetration and focusability of ultrasound, the ultrasound wave can focus on the target tissue and will increase the local tissue, the target tissue temperature to 60 to 100 degrees. Using the mechanical effect, thermal effect, and cavitation effect of focused ultrasound to induce the target tissue called agglutinative necrosis. So the next figure shows the MRI compression before and after HIFE treatment. So we can see that after treatment, the lesion location is homogeneous and no obvious enhancement. And we can verify the treatment results according to the tissue discharged from the patient vaginal. We can see scotch-like necrosis with blood clots, this tissue. And under microscopy, we can see the very significantly coagulative necrosis changes. So our research is sponsored by some Chinese funding, and our results has been published, and the results of the study it also cited by the FIGO in their 2018 placenta accreta guidelines as a new methods. So this is application throughout my country. And advantages of HIFE treatment for placenta accreta. I think every disease, as another doctor said, every disease needs comprehensive treatment, not just one. So I think sometimes drug is very effective. Sometimes we need alternative and additional treatment to enrich our treatment. So HIFE treatment for the placental accreta have some advantages, including painless and non-invasive, reduce amount of bleeding. Of course, at the same time, will reduce the use of blood products and preserve the uterus and maintain the integrity of uterine muscle fibers. No effect on reproductive ability, and so postpartum breastfeeding. And the uterus for every woman is very important. Life is low-intensity focused ultrasound will promote postpartum uterine involution. So poor uterine involution is the most common cause of late postpartum hemorrhage. As we know, after delivery within 6 weeks, the value of the uterine cavity repeatedly shrunk from 5,000 milliliter to 5 milliliter. So, but now the treatment for the promote uterine involution is very limited. So uterine massage and some drugs as oxytocin and some surgery, but the limited effectiveness for surgery and medication, so cannot meet expectations. So we need to find new methods to treat it. So low intensity focused ultrasound promote uterine recovery by mechanical effects, thermal effects, and physical and chemical effects. Mechanical effects including, for example, open the catheter channels of uterine muscle, and thermal effects, for example, it can increase the target tissue, the uterus, the local tissue, the temperature of local tissue very slightly, less than 38 degrees, very soft, and the patient feel very comfortable, and some physical and chemical effects. So since 2010, our department has been leading the clinical trial and CFDA certification of life to promote uterine evolution. So according to our multiple center RCT study, the results of the study shows 5 treatments within 3 days after delivery were performed, and it confirmed that the low-intensity focused ultrasound can promote uterine contraction and shorten the direction of lochia, and there's no adverse effects. So we also pay attention to the international academic exchange of LIFE project. So clinical application of LIFE in promoting uterine evolution, so the number of treatments nationwide has exceeded 1 million, which has been unanimously recognized by medical staff and new mothers. So part 3, the development prospects of focused ultrasound in obstetrics. So some of these are our research plan. The development prospect of focused ultrasound in obstetrics. First one, LIFE in prevent and treatment of postpartum hemorrhage. So we ahead the LIFE treatment for promote the uterine contraction to the from the third stage, and focused ultrasound. Focused ultrasound ablation surgery in intrauterine treatment of complicated twin pregnancies. You know, complicated twin with some blood vessel communication will induce very bad results. So we can use maybe we can use HIFE to melt, stop the communicating vessel. The third, LIFE in treatment of postpartum pelvic flow dysfunction. So after delivery, every woman face the pelvic flow dysfunction. So the focused ultrasound can promote the tissue healing and increase and make the new mother feel better. The fourth, ultrasound therapeutic device in treatment of joint and muscle pain during perinatal period. Every mother is very hard. To be a mother is hard work from you have the baby in your uterine. So we must help them. Thank you.
Thanks, Dr. Zhang Hua, for the instruction of the new and revolutionary revolutionary spatial HIFE device in obstetrics. Thank you again.
现在为我们进行讲解的是来自
Speaker is from Russia, Inna Apolikhina. She is a doctor in mathematics. He's a MD professor, head of the Department of Aesthetic Gynecology.
Dear colleagues, dear Chairman, my name is Inna Apolikhina. I am head of Aesthetic Gynecology and Rehabilitation Department, Moscow, Russia. First of all, I would like to thank the organizers committee to invite me and it's possible to share our data and experience. It's our conflict of interest disclosure. We use equipment CZF. It's very interesting equipment for lower genital tract. Our research center incorporates Institute of Obstetrics, Gynecology, Perinatology, Oncogynecology, Mammology, and Reproductive Medicine. There are also 9 institutes and more than 20 laboratories carrying out research work. I would like to take a few minutes of your attention to describe our department and its activity. The Department of Aesthetic Gynecology and Rehabilitation was first opened in Russia in 2019. Today is multifunctional department that uses all the innovative technologies of diagnostics and treatment of gynecological diseases. For 8 years, we have been training doctors, conducting scientific research, and providing medical care for women with various gynecological diseases and aesthetic problems. According to the data of our department, over 2014-2020 years, the incidence of lichen sclerosis among other vulvar disorders is 63% and it grows every year. Now we actively cooperating with China, especially National Ultrasound Medicine Engineering Research Center. And now let me share our experience in using HIFU technology in treatment of non-invasive or non-neoplastic epithelial disorders of vulva. We use a special nozzle to treat the vulva. Before HIFU treatment, we usually perform effective local anesthesia with, as usual, 1% of lidocaine. That is how we perform the HIFU procedure on vulva. And after effective anesthesia is pretty comfortable for our patients. Our observational study included now 173 women with 78 women with lichen sclerosis and hyperkeratosis. As usual, we perform 2 HIFU sessions, and the follow-up period is on 3, 6, and 12 months after. We diagnosed vulvar disorders by means of visual examination, valvoscopy, optical coherence tomography, ultrasound, microbiome, HPV with PCR reaction, and fluorescence diagnostics and punch biopsy. The diagnosis were verified by punch biopsy and histological examination. Indications were tumor eradications and its exclusion, insufficient therapy of standard therapy, and differential diagnosis with vulvar intraepithelial neoplasia, lichen planus, and other dermatosis of the vulva. For effective visualization of neoplasm, threads, and fillers, we use high-frequency ultrasounds of the vulva, 12 to 23 Hz. This allows us to examine superficial structures. This slide shows a possibility of ultrasound diagnostics in the assessment of blood supply, elastography, even measurement of thickness of dermis and epithelium. We actively use also a mobile colposcope, EVA, which allows effective early diagnostics of vulvar disorders and online consultation. I want to emphasize that it's very important to diagnose vulvar intraepithelial neoplasia and vulvar cancer as early as possible. Quite often we diagnose these diseases in patients who address for aesthetic problems. For example, the bottom three photo shows serious vulvar conditions such as VIN3, now we call HC, extramammary pages, cancer, and melanoma of vulva, while women come only with a complaint of itching of vulva. Extramammary pages cancer is a rare type of genital cancer, of course. Usually it's treated by vulvectomy. Fluorescence diagnostics allows to determine the exact stages of the tumor, thereby reducing the resected tissue demand during surgery. Since 2022, in cooperation with Russian physicists from other regions, such as Nizhny Novgorod, we have started development of a new method of multimodal optical coherence tomography to diagnose lichen sclerosus. Optical coherence tomography is an emerging tool for non-invasive visualization of the tissues with high resolution up to several micrometers and penetrations depth up to 2 millimeters. This method correlated well with histological examination, and we can assess the dynamics in the restoration of the structure of connective tissue, epithelium, tropism, and blood vessels at different epithelium lasers. In this picture you can see this equipment, and often we use these diagnostic tools in diagnosis of lichen sclerosus. So I would like to show you several clinical cases. Patients 68 with lichen sclerosus and genitourinary syndrome of menopause, treated by 2 sessions HIFU and estriol cream 0.5 milligrams per vagina twice a week. The follow-up period was 14 months. Then symptoms of cracking returned, and patients started PRP and topic glucocorticosteroids because of COVID-19 pandemic limitations. These patients improved symptoms, and she satisfied from treatment, but she had cracks in posterior commissura, as you can see on the last picture. Here is another second case in the patients 42 with lichen sclerosus and stress urinary incontinence. She was treated with 1 HIFU session. Follow-up period was 6 months. Then itching and burning returned, and the patient started PRP plus glucocorticosteroids. This clinical case demonstrated efficacy of HIFU is limited to 3 months. Besides, HIFU technology has no therapeutic effect on stress urinary incontinence. Third case in the patient 73 years old with lichen sclerosus and genitourinary syndrome of menopause. She was treated with 2 HIFU sessions. Follow-up period was 6 months. Then symptoms such as itching and burning returned, and patients started PRP plus glucocorticosteroids. The next clinical case in patient 36 with lichen sclerosus. She was treated with 1 HIFU sessions. We observed reducing the main symptoms of lichen sclerosus, itching. Follow-up period is 12 months. The patient is under observation. The fifth case in the patients 42 with lichen sclerosus. She was treated by 2 HIFU sessions. sessions and estriol cream, 0.5 milligrams per vagina, twice a week. Follow-up period was 1.5 years. Then symptoms of burning and cracking returned, and patient started standard our procedure, PRP plus glucocorticosteroid with optimal effect. In this picture, you can see interesting patient, 44 years old, with vulvar hyperplasia. She was treated with 2 HIFU sessions and 3 sessions of autological platelet-rich plasma procedures. All symptoms disappeared, but visual changes were insufficient. Follow-up period was 2 years. Patient started topic glucocorticosteroids once a week, and we consider HIFU in combinations with glucocorticosteroids to be more effective in case of severe hyperkeratosis. This is a very interesting clinical case too. Patient 40 years old with lichen sclerosus and vulvar synechiae. We performed treatment with estriol cream, local estriol cream, 0.5 milligrams once a day, 2 times a week, mometazone cream in case of severe itching, and HIFU 1 procedure. We provided synechia resection in future with surgical CO2 laser. Sorry, that's video. This slide shows successful cure of patient 39 years old with vulvar intraepithelial neoplasia, mild degree, now we call high, HC, after 2 sessions of HIFU and at 3 months interval. She had no visual sign of VIN, but after 2 sessions of HIFU, we observed disappearance of itching, and according to histological examination, we started complete cure. In this picture, you can see a clinical case in patient 48 years old with lichen sclerosus. We performed 2 HIFU procedure with 3 months interval. Symptoms of burning completely disappeared. Follow-up period was 1.5 years. Then cracking returned, and patients took 2 PRP injections with optimal effect. A very important question remains. What is the optimal interval between HIFU sections? The patients on case 10 treated with 2 HIFU procedure of monotherapy with the interval 6 months, and we concluded that it was very long time with sessions and the diseases relapsed. By now we provided 3rd session and added hyaluronic acid and topic glucocorticosteroid with optimal effect. Patients 58 years old with lichen sclerosus. This patient is very interesting because 2 years ago she had cancer of vagina. These patients performed radiations and surgical therapy for the cancer of vagina in situ 2 years ago. We performed 1 session HIFU, which intermittent therapy with glucocorticosteroid, mometazone, cream of vulva twice a day for 2 weeks, 1 month rest, and repeat. Our data shows that HIFU technology is more effective in young and premenopause women. 72% of patients noted the absence of itching and burning 1 to 3 days after procedure. The optimal course is 2 sessions, and interval between procedures is 3 months. High efficacy when combined with PRP or glucocorticosteroid or hyaluronic acid, and adverse events were reported in our investigation in 2 patients. It was burning. In our investigation, only 2 patients showed local skin burns. We presume that this complication could be caused by a defect in the lens. Patients were successfully treated with regenerative local ointment and physiotherapy. Often we use low energy laser and other method of physiotherapy. In conclusion, I would like to say that HIFU therapy advantages are low, it's minimally invasive precision procedure of our outpatients, repeated with no limitations, high efficacy with low adverse event, and of course needs further multi-center randomized clinical trials. Since 2019, our institute has actively collaborated with China researchers, and of course I hope that our cooperation with HIFU technology will be continued and results of our work can be published in our joint reports. Our weapon is knowledge, but remember, it may be knowledge that we may not know we have. Thank you for your attention. 谢谢。
Thank you, Ina, for telling a very good approach on vulvar disease treatment and what's the future. And we have seen that after the follow-up visits, the patients have improved their skin conditions and the lesions have been improved. So this is a very good way for doctors to use during the outpatient treatment.
Professor Zhou Hongwei, she is a professor of obstetrics and gynecology, vice president of affiliated hospital of Clinical Medical College of North Sichuan Medical College. Okay, please. Our time is limited. We must move forward. Yeah. Okay.
Everyone, 大家下午好。
Good afternoon, everybody.
今天呢，
Sitting here, I feel very honored. Previously, I wanted to speak English, but I saw there is a pretty interpreter sitting in the booth, and I'm afraid that my Chinglish cannot be understood by the interpreter and the international experts. So I will speak Chinese in my presentation. So today I will talk about the application of high-intensity focused ultrasound therapy for high-risk HPV-related cervical lesions. The cervical cancer is the fourth most common malignant tumor in women worldwide. And globally, people are calling for the elimination of cervical cancer. Because HPV is related to cervical cancer. Actually, there is a process for the treatment of cervical cancer. If there is a further infection, some symptoms can lead to cervical cancer. But actually, if we discover the HPV infection in the early stage, we can prevent the occurrence of cervical cancer. But as a doctor of obstetrics, we know that the ablation is a very important way, and the traditional way we use includes CKC and FU. We also use a laser colonization to obligate the lesion. So a lot of study has proved the effects of incisional treatment. And so we know that there could be adverse impact of cervical lesion treatment on fertility. Because numerous studies have confirmed that the treatment of preterm birth and premature rupture of membranes is correlated with cervical length, and as the depth of cervix increases, the risk also increases. When the cervical length is greater than 10 millimeters, there is a 50% increase in risk of every additional millimeter. So we need to find a new therapy which can enable us to clear HPV and treat SL and preserve the integrity of the patient's cervical tissue and function and protect their reproductive ability. Since there is a decreasing new population now, because first people don't want to give birth to new babies, some of them don't want to have babies, and some of parents could not have babies. So for clinical doctors, our purpose of treatment is to enable our patients to have very good health conditions after disease. So when we focus more on the ultrasound treatment, is penetrability is better. I will play a video for the process of treatment. We need to test the energy of ultrasound. We use the head to the cervical part, and we needed to ensure proper speed. So we needed to treat for 3 minutes, and when the tissues is red, we have to stop. So we need to be careful. And this way is there are many hospitals are using these ways to treat cervical patients. What about the effect? A lot of experts have used this method to the HPV infection. The study focused on a treatment group of 90 patients receiving ultrasound therapy and an observation group of 90 patients. The study aimed to assess the HPV clearance rate and CNN lesion progression rate after 6 months of FU treatment. And our hospital also did some studies. The first one is we use the focused ultrasound treatment, and we also witness the clearance rate of HPV. We have discovered that after 6 months follow-up, the treatment group had a clearance rate of 75.6% for HR-HPV, while the observation group had a clearance rate of 25.6%. After controlling for confounding factors, the results of the multivariate logic regression analysis showed that the treatment group had a HR-HPV clearance rate of 9.03 times higher than the observation group, and the clearance rate for single-type HR-HPV infection was 5.28 times higher than that for multiple-type infections. And also our team made other ways of treatment, and we have chosen 29 patients who wish to have babies, and our center has done HPV-related cervical inflammation treatment. And in total, there are over 2,600 patients received our patients. The clearance rate of HPV after 6 months of treatment is 56% after 12 months. This was 75% with a median clearance time of 6 months after surgery. The overall effectiveness rate of HISO treatment, including improvement and cure, is 96.49%. So this is very good performance after treatment. While we are doing this work, we need to ensure that the lesion exceeds 75% of the cervical area, cannot be used this way. And we need to work with communists to do some collective study to ensure that when the lesion exceeds 75%, we can also use our method to treat it. So this slide shows some photos of before treatment. She is HPV 52 positive cervical biopsy, such as HISO. She underwent a focused ultrasound treatment on December 3rd, 2023, and she was very worried. She looked up some information in the internet. She was afraid of the effects on her fertility after marriage. That's why we use HIFO. So after treatment, we studied on the effectiveness of the treatment. The clearance rate of HPV after 6 months of treatment is 56%, as I suggested now, and after 12 months is 75.4%. And in terms of clinical pregnancy status, there were 23 cases of patients with a desire for fertility after HISO treatment, with an average age of 22 years old after treatment. The success rate of pregnancy and the rate of spontaneous abortion in patients with a desire for fertility were 73.9% and 5.9% respectively. There were 8 full-term births with 6 vaginal deliveries and 2 cesarean sections. So this shows the photos of patient who is 29 years old, married recently, and we use ultrasound treatment on her. 7 months after treatment, she had a baby. She was pregnant. So for this patient, we have done a lot of work for her, and we have done a lot of studies on other cases, and we have done some follow-up on them, and we done some study on the elastic features of her, and she had a baby on March 11, 2023. At 40 weeks of pregnancy, there were signs of impending labor. On March 12, 2023, vaginal delivery occurred with a rate of 3.1 kilograms and a length of 49 centigrams of her baby. The baby scored 9 points on evaluation. Why are the effects after using high cell and low cell was very good, and we also did done some study on the changes in cervical cytokine profiles following focused ultrasound treatment for high-risk human papillomavirus infection related to low-grade cervical lesions. We also found that after focused ultrasound therapy, the regression of cervical lesions on clearance of HPV may be related to the improvement of local cervical immune status and the delivery of vaginal microbiota. And cytokine IL-10 is significantly positively correlated with microbiome richness index SOPs and diversity index Shannon in the study samples. In terms of summary, HPV infection may have some effect on female fertility and psychology. So we know that a lot of patients were very worried. They cannot fall asleep in the evening because of fear. So what should we do? What can we do? We can let them let their lesions controlled. So high cell patients after treatment should be followed up by our doctors. So, and we should know that there is no one-size-fits-all prescription, so we need to tailor treatment for different for different patients. I'm from a very beautiful city at the riverside of Nantong, and we have very beautiful food. We welcome you to go to our city for a visit. Thank you very much.
Professor Cheung give us some more idea about HIFU treatment application in our gynecology. Okay, Q&A time. Welcome our speaker. Yeah. Any question? Time is limited. Dinner time, yeah. Oh, okay. One speaker flying away. Okay. Any question? All talk is clear. Okay, go ahead.
I have questions for you because I'm impressed from your data, and I would like to know about if you use only HIFU technology, or how often you combine HIFU technology with other technologies such as radio frequency, laser, mostly CO2 laser, electrotherapy or cryotherapy. Understand me, yeah?
It's a good question. So, in previous time, we use HIFU and laser. We have a comparison. We found that for laser, there are smoke, the pollution, radiology, and HIFU had better results, so we phase out the laser and we choose HIFU. And actually, HIFU patients, Ribison with HIFU is also a combined treatment. We have a comparison as well. We think medication compared with the previous treatment. I had a previous study that we use HIFU to treat patients compared with medication. So we found that HIFU is better than medication. And using HIFU alone did better than HIFU combined with medication. So we have over 2,000 cases based on our data. Basically, we only use HIFU because it's better compared with other combined solutions. Thank you.
I'll give you that question back. The same question you asked. In the treatment of your vulvar, like sclerosis and everything, did you compare with laser, HIFU, combined treatments? Because what I heard here today is fantastic, but I think in Europe, nobody would start using HIFU for HPV or as a conization, or for sclerosis, for instance, without hard data.
Yes.
Yeah? So if you compare, let's say, sclerosis, vulvae, if you do that with a laser, medical treatment, or HIFU, what is the balance of that? For you have the same question.
Thank you for your question. In our department, we have several possibilities to treat diseases of vulva. We have CO2 laser, we have erbium laser, we have neodymium laser, we have radiofrequency therapy, and we have photodynamic therapy. And now we prefer HIFU technology because 5 or 10 years ago, we demonstrated our data about photodynamic therapy, especially in Russia. We have a lot of fluorescence sensibilizer. We have Russian fluorescence sensibilizer. And in my opinion, HIFU is very perspective because I agree with Professor about CO2 laser. And we have excellent data about combined CO2 laser and PRP technology. We use Regent Lab, PRP from Regent Lab laboratories, autological PRP technology. It's nice. But I think in future we should effectively combine this method. Especially today in the exhibition, I saw a lot of fantastic remedy from China, traditional medicine. And I think in future we should effectively combine HIFU technology, medications, and, for example, Chinese medication, and 50% imiquimod, as you know, because imiquimod is a very useful remedy against HPV lesions and vulvar diseases. We need combined.
Thank you. I have a final question.
Yeah.
What I missed is condylomata acuminata.
Yes.
Maybe I missed it,
Mm-hmm.
but don't you think that would be maybe also because we treat condylomata with laser? Maybe we should do it also with HIFU. What do you think about that?
We have huge experience in the treatment condyloma acuminata. We use very successful photodynamic therapy with 50% of ALA, sense aminolevulinic acid, 5% of aminolevulinic acid. Then we use very successful CO2 laser, of course. But we need also combine, very successful combine. For example, CO2 laser with 5% of imiquimod. We may combine HIFU technology with 5% of imiquimod and other remedy. And now in Russia we have analog of remedy from Europe, special remedy from phytotherapy against HPV infection. Yes. Maybe you have another opinion?
我再回答一下。
I will add to that question. So the things we need to pay attention to, the laser is used for vulvar the lesion, because the machine cannot go very deep into vagina. It's because of the discussion how the HIFU can evolve, because we need to think about how we can use HIFU to treat very deep in the vagina. The second is that the depth, the posterior and anterior of vagina, they are important organs. So it's very important we control the distance and the depth to avoid damage to other organs. So there's no one-size-fits-all solution, so combination solutions in some cases are very reliable and effective. Thank you.
If possible, in addition to your answer, I would like to say, mostly in future, I suppose we will use HIFU technology on vulva and cervix. Because on vagina, we have not a long depth, and it's very dangerous to use HIFU technology on the vagina. Yeah.
Okay, congratulations for both presentations. My question is in the same line that Hugo, because the standard medical treatment for vulvar sclerosis is corticosteroids. After this treatment, the results are very good, and the results are similar than this. And okay, in your series, you treat with corticosteroids plus HIFU. It's very important, I think, very important to find out the good results are for the corticosteroids or for HIFU. And it's very important, for me, it's a good idea to, in the same line of Hugo, to do a comparative study. HIFU alone, HIFU with corticosteroids, okay, it's very important because we don't know in this moment what's the best treatment of both. Probably both. I'm sure in the future we can demonstrate, but in this moment, your patients are treated with both treatments. And medical treatment is effective to treat these patients. medical therapy.
Now we need clinical trial, randomized clinical trials. Of course, in Russia we don't have HIFU technology in guidelines, unfortunately, and we need multi-central clinical randomized clinical trials, and in future maybe we will have HIFU technology in our national, our guidelines.
I have a question. I want to know the price for the HIFU treatment in your country. It is cheaper than other ablative treatment or higher?
During our observation study, it's free of charge. No.
Yeah. No. Okay. Thank you. Any question? No question. Okay. Thank you for all your attention. And welcome to here. We take a picture. Okay. Thank you.
Everybody, shall we? Sorry. There is another panel. I forgot it.
Okay. Ladies and gentlemen, good afternoon. This part is the last section about this meeting. So in this section, is my great honor for me to be the chairman of this section with Hugo. Okay. So now in this part, we have 4 HIFU experts to have a seat in this stage. So first of all, please, I wanted to introduce my partner about this section, Dr. Hugo. He's the endocrinology, reproductive, and preventive medicine, and the medical director at the private center of endocrinology, preventive medicine, reproductive medicine, and gynecology of Germany, and also the consultant at the Lab Expert Center, Beijing. So also Professor Hugo is the chairman of ISGE working group on non-surgical ablative therapy of benign uterine disease, ISGE, and so on. It's my great honor. Nice to meet you.
Thank you so much, Professor Cheung. I think my co-chairman doesn't need that much introduction to the Chinese people, so I'll only say he's a professor at Nanjing Medical University at the Department of Obstetrics and Gynecology, and he has, of course, a very impressive CV, and I think we shouldn't read everything here, as most of you know, Professor Chen, but I would like to say it's also for me a great honor to share this final session with you. And we prepared 2 topics. And the first topic will be fertility preserving therapy of adenomyosis. We heard before from Jordi and from Dr. Subramanian that fibroids, the treatment of fibroids, could interfere with fertility, but we didn't cover, fortunately, adenomyosis. So, shall we now call the first four?
Yes, I think this is a very interesting topic about in the gynecology. So, first of all, I wanted to introduce Professor Peng Jie Song. He comes from the Gynecological Hospital of Hubei Gynecological Group Limited. He's the Deputy Chief Physician, Director of Ultrasound Medicine Departments. Welcome.
Okay, second one, you. Thank you very much. The second one is, I hope the pronunciation is correct, Professor Cheung. She is a professor at Obstetrics and Gynecology, and well, it's all again, you can read everything here. We do not need to do that. Professor Cheung, where is she? Oh, welcome.
Okay, the next professor is Ma Hongliu. She's the Director of Gynecology, Deputy Chief Physician, graduated from the Department of Clinical Medicine of Chongqing Medical University, and has been engaged in obstetrics and gynecology department since 1996. So specialized in the diagnosis and treatment of general gynecology, gynecology oncology, pelvic floor dysfunction, reproductive endocrine, and other disease. You are welcome. Welcome. Okay. Okay, the first one, you.
Yes. The last participant of this panel discussion, it's very easy to pronounce. It's Professor Wang. It's my information that you are working at Kunming Medical University, and as I see, you are interested in floor dysfunction, reproductive medicine, everything what we are going to discuss here. So let's immediately start, and I would propose, may I stand up?
Oh, of course.
Of course.
Let me guys walking around.
Yes.
Okay, you follow me?
Yes.
Now the first topic is about the treatment stage for uterine myoma, fibrosis.
We change it again.
Yeah.
Okay.
Okay, please, you, Hongliu.
May I maybe give, I heard today in the last few days, always the same thing. The gold standard for the treatment of a single myoma is endoscopy. I would like to hear your comments on that. And then later I'm going to ask you the questions, the same questions for adenomyosis. So what do you think? What is the optimal treatment for a single myoma?
Yeah, thank you.
I'll speak Chinese. For the uterine myomatosis, the golden standard is individualization, because for different patients we need to adopt different treatment method. There is no one-fit-all solution. So in terms of the golden standard, we need to target at the patients. For example, some person has the desire for fertility, so we need to see her requirement and her conditions. And some patients just want to save her uterus, even though she doesn't want a baby now. So we need to, based on the requirement and condition and economic conditions and follow-up conditions, to choose the way for treatment. Maybe HIFU is a good way, and some other treatment may be the good way. So, all in all, we needed to base on the conditions of patients to choose the treatment. And there are some special things. Maybe some patients are from very remote countryside, so she may choose hysterectomy because she cannot come to hospital quite often. But for me, I did not recommend using drugs to treat this disease because according to my experience, there is no very effective drug to treat urinary malmatosis.
Yes. Of course, we need to make the distinction between infertility and menopausal women.
Yeah,
but
yeah.
My topic was now in specify in women who still wants to conceive. She has a single myoma. What would you tell her? I know what those guys would say. What about you, ladies?
Okay.
Thank you.
Oh, yeah.
Okay, 他说了. Okay, what would your advice be for a patient coming to you? She's 35 years old, she has a big myoma, and she says, okay, I want to have that removed because I have pain, I have irregular bleeding, and I want to conceive, I want a baby.
They want to have baby, so for these patients, what's your choice for the patient?
这个前面这个老师已经
Actually, it should be a personalized treatment. And based on the conditions of this woman, based on her age, we need to let her to choose. In the afternoon, we hear a lot of presentations. Many experts talk about HIFU treatment. I think the key is to ensure fertility of the patient. Thank you.
So you know, myoma, it also causes fibrosis. Maybe there are many types. For example, submucous, intramural, and subserous. So which type is the best indication for HIFU? So if you choose HIFU to treat the myoma, according to the position and the subtype, what's the energy difference between the model? So please. You understand me? Okay, 我在中文叙述一遍。
Let me speak in Chinese. We know that myoma has different types. Which subtypes is using which disease is more apt for using myoma. Actually, we need to choose the best, the most appropriate way for patients. We need to personalize treatment way. Treatment aims to protection. For example, because patients face many different risks, for example, the rupture, etc. We need to also think about the protection of the functions of ovary. There are similarities between the uterine myoma as well as the uterine fibroids, but we need to ensure protection and fertility.
I think you should have your opinion also. So once again, single myoma, infertility patients, young, 35 years old, what would you advise her? And then we go to the other guys here.
好，是这样子的啊，子宫肌瘤和子宫。
Now, mitosis and the Fibroids are different diseases. Two patients may have similarities in their symptoms, so there can be some similar treatment. For example, some patients want to ensure fertility, so one treatment is to ensure their fertility functions, and for the myomatosis, we need to evaluate her conditions. Traditional ways can ensure treatment, but it may cause wound or scars, which may undermine the function of fertility, but HIFU can ensure the overall of urine. So this is my opinion.
Professor Hugo, now I answer your question.
So you talk about the question, single myoma with fertility requirement. So what we choose between is minimally invasive or non-invasive. Non-invasive would be the first and foremost choice. And if for the laparoscopic with only one hole that is still damaged, there is risk of rupture. So for those with fertility requirements after evaluation, we would recommend her to use HIFU if he applies to the conditions.
Dr. Selva, so I have a question for the national. I know what you're going to say, but so you comment, please.
Sit down and answer.
Jordi, you are next.
Now, 35 years old, one single fibroid, and we think that fibroid is causing her infertility. Am I right? Maybe, okay. Now, in my country, I'm the only one doing HIFU. So not many people know about HIFU. So when I talk to them, I will first tell them that in my country, I am the only one. So in my country, what I will tell them is, okay, you have a fibroid, and I think this is causing infertility. So you need to do something about it. And I tell them that I can offer you operation, laparoscopic myomectomy. And if they say, I heard that you are doing HIFU, then I'll bring up HIFU. Because I don't want to offer HIFU, and if something happens, they will blame me. So if they say, yes, I heard that you are doing HIFU, yes, I do HIFU. HIFU is a good technology. It's got a lot of benefits, and I'll tell them these are the benefits of HIFU, these are the benefits of myomectomy. You decide what you want. And that's how I deal. I don't push HIFU to them because it's new, and I don't want them, if something happens, to tell me that you suggested HIFU to me. I came to you for operation, but you suggested HIFU to me. Many patients come and look for me for HIFU. If they walk in and tell me, okay, I want HIFU, then I'll tell them the advantages and disadvantages of HIFU versus myomectomy, and let them decide on the option.
Professor?
Okay. Very good. I have a question for you.
Okay, another question. Yeah.
If a female, young female, just one single myoma, the myoma, the diameter is about above 4 centimeters. 4 centimeters, but no clinical symptoms.
No, intramural.
Yeah.
Probably intramural.
Yeah, maybe in the blood, but we know if the diameter is about 4 centimeters, we will have the influence to the fertility.
Yeah.
Yes, so if the patients want to have a baby, what's the choice for her?
Very good question. Very good question. Okay, for example, a young patient with 4 centimeter fibroid, intramural, asymptomatic patient, we don't know is infertility with infertility or not infertility, okay? Okay, in this case, the treatment, we can offer a preventive treatment to avoid future problems of the fibroid, but not in the present. And okay, it's difficult. in my hospital, we offer HIFU in these patients because the natural history of the fibroids in young patients, principally in patients with a fibroid with great perfusion, very vascular fibroids, the natural history is to increase in the future. All the cases, faster or not faster, but a 25-year-old woman with a 4 centimeter with no symptoms in 1, 2, 3, 5, 6 years, they will have symptoms and perhaps infertility problems. It's for sure. I don't know patients with 4 centimeter fibroids with high vascularization in the fibroid that not increase. And we can do HIFU now to avoid problems in the future. Because HIFU has demonstrated with strong evidence that is safer than myomectomy in terms of aggressive treatment, okay? No complications, no hemorrhage, no infection, no scars. You operate these patients? No. You don't do HIFU, you don't operate, you wait 1, 2, 3 years, and when the fibroid is 6 centimeters, no, you operate because it's your first option. I think it's not a good idea. For me, it's a good idea to treat to avoid future problems. We have strong evidence it's safer, and okay, we have some patients treated in this manner. Yeah. Not so much patients. I don't have strong evidence, but
it's of course important. You are offering laparoscopic treatment and HIFU.
Yeah, I'm a surgeon.
The only one in Malaysia.
Yeah.
So, and that's like the same thing with IVF. You never propose something for the patients what you're not doing yourself. Eh? Yeah. So, but shall we ask the audience what they think?
Sorry, Hugo, with an exception. This patient, 4 centimeter intramural fibroid, wants to conceive?
Conceive, yeah.
Okay, first attempt to conceive spontaneously, if not, without
treatment.
Without treatment, yeah, because it's intramural small fibroid, okay. No, it's if she wants to conceive immediately, no, first is to try to conceive because it's not distorting the uterine cavity. If not, in vitro fertilization, if it's necessary. If the first attempt is failed, okay, HIFU. In intramural, not distorting uterine fibroids, okay?
Okay. Do you agree with that? What he was saying? So, ladies and gentlemen.
So in addition, if the patient don't want to have a baby, so yeah, just now you told me that if the patients want to have a baby, so maybe we'll give the treatments for her because the myeloma maybe influence the fertility. But now the patients have finished the fertility. So what's your choice for her? Observation, drug, or HIFU, or observation? You please.
I am conservative, I'll wait. I'll wait because there's no rush to do the procedure. If I'm always worried about complications, if I'm really unlucky that 4 centimeter fibroid I do and have a bowel perforation, everybody will turn around and ask me, why did you do the HIFU on a 4 centimeter fibroid which is asymptomatic? I got no reason to do it.
Okay.
I must have a reason.
I think it's also very individualized for patients. They do not have indications for surgery, and we can also let them observe, but the patients would get anxious. That affects their normal life. The myeloma is the most severe problem in her life. Even with our communication and knowledge, these patients are still anxious. So for those patients, HIFU is a good option because it is non-invasive. And for 2 cases, the first is big myeloma fibrosis. We can also observe, that's the common sense. We can give options HIFU or open surgery. The second is the small fibrosis, but still anxious. We would recommend her HIFU more. So what we are different here in China, we have challenging healthcare conditions, but I would offer more clinical choices to my patients. Which one is better? I would make recommendations. So 80% of patients would listen to the professional suggestions from doctors.
Thank you. Do you agree with that?
I agree that patients listen to doctors.
Okay.
Any comments from you?
Yeah, you have the new comments?
哎，对，是的，我也。
So I agree with Ms. Han. Why? That is because the indication for surgeries for fibrosis very rigid, symptomatic, bigger than 4 centimeter. So the fibrosis is growing. 4 centimeter, 3.5 centimeter without symptoms. However, she is 20 years old, but with 5 years or 7 years later, the fibroid will grow bigger beyond 4 centimeters. So with asymptomatic cases, so we can use non-invasive method HIFU to stop the evolution of the fibroid. So we need to have early prevention, early treatment, early intervention. So early movement would reduce the harm for patients and maximize the benefits. That's what we want as doctors, right?
Maybe it's better than the treatments. Understand? You agree with me?
Second?
Okay.
Are we finishing this topic or do we have still time? You must decide. Pardon? We need to move to the second.
So much for this topic.
I would like to ask the people here sitting. Patient with single myoma, yeah, with 35 years old, she wants to conceive. What would you do? Who would wait till she conceives on the romantic way? Who says that? Difficult. You too?
Second option.
All right. And the second option is intervention, HIFU, or laparoscopic treatment. Who would do that? Nobody.
But it's different, immediately or in the future?
Well, probably. Thank you very much. We move now to the second
topic.
Monsieur.
But the Chinese and the English is not correct. Someone you see the first fertility preservation for adenosis, not uterine fibrosis.
No.
Number one topic is the fibrosis.
Actually, I found some wrong English.
Questions for all the rulings.
So, the second topic is?
The second topic is?
Observing treatment of adenomyosis. And my first question is, fibroids interfere with fertility. We learned that all today. What is your opinion? Does patients with adenomyosis have a reduced fertility chance without any treatments? Are they infertile because of the adenomyosis or not? What do you think?
这个他那个。
In my point of view, adenomyosis may cause more factors of infertility. Adenomyosis has more side effect on the infertility because fibroids, if not serious, do not have very big impact on fertility. And yet, adenomyosis may cause a lot of bad environment inside the urine, so it may have more side effect and bad impact on the infertility. I think adenomyosis may have a bigger impact on infertility first. It may impact the environment in the intima, and also it has impact on ovarian. Sometimes it causes the lower quality of ovulation. So this may lead to more possibility of infertility. There is clear evidence that infertility is closely related to adenomyosis, and I know some doctors know this one too. And many women do IVF because of adenomyosis, and sometimes adenomyosis leads to the failure of IVF. So adenomyosis cause more severe impact on infertility. I agree. Adenomyosis have bigger impact on fertility because it has impact on the endometrium, among other reasons. Among infertile women, a large proportion of suffer from adenomyosis. And adenomyosis leads to bad labor and delivery.
I have nothing to add. I think we all know that adenomyosis decreases fertility. We know that.
Yeah. Okay, so now we know adenomyosis is a fertility factor. How are we going to treat that? I think we are not going to say that surgery is an option. You heard maybe this morning Professor Rudy. Only a few people can do open or laparoscopic treatment of diffuse adenomyosis. So we have only two possibilities: medication, or HIFU.
Or operation? No. Okay,
well, so maybe for you, but I think in Europe, the Koreans are doing that. So I know that.
As for the adenomyosis, maybe I have another question.
Yes?
So you know, adenomyosis may be divided into the diffuse adenomyosis or the adenomyoma. So I want to ask you that, if you choose a HIFU treatment, so is the energy and mode the same or not? So what's your opinion? What's your experience? Or around international, not just Chinese. Selva, okay, you.
I mean, focal or localized adenomyosis, fortunately those are more common than diffuse, easier to do than diffuse. I think everybody agree. I mean, if you have just posterior adenomyosis or just anterior adenomyosis or just one area localized, it's easier to do. We can ablate that area. Diffuse adenomyosis is much more difficult. You have to do posterior, anterior, and fundal. It's far more difficult. And I always tell my patient, when you have a diffuse adenomyosis, I am going to hit your endometrium, and your pregnancy rate is going to be affected.
Yeah, but what alternative do we have for
I will tell them to do IVF and have an embryo transfer without HIFU first. Don't blame me for them not getting pregnant if I do HIFU. I'll say you must do IVF. I will not do HIFU for you until you do IVF. And you do an embryo transfer, and you fail, and then you come to me. Then I know that I am not causing you not to get pregnant. That's how I deal with my adenomyosis patient.
Doing, please?
You agree with?
So our suggestion HIFU comes first because it's minimally and non-invasive, because surgery will cause damage to the myometrium that will further preserve fertility.
I'm not saying surgery, I'm saying IVF. 试管婴儿，我做试管婴儿，你明白吗？
So if the patient's the adenomyosis is diffuse, so first, as for me, I advise the doctor for her, maybe at the first choice, maybe I suggest the patients first get the Gynaecology injection, then shift the patients to the IVF. So if the adenomyosis is adenoma, usually the Gynaecology is not so effective, so maybe the HIFU is a good choice for the patient. Then Gynaecology combination then saves the patient to the IVF ET. You agree with me?
Yes. Can I ask a question? Yeah. No, I just thought that, in fact, I've come across a number of patients. You all know that adenomyosis a lot of time is associated with endometriosis.
Yes.
And very often now I see patients, they have adenomyosis, they have a small chocolate cyst outside the ovaries, and you can say that it is quite possible they have extensive pelvic adhesions with the endometriosis. And mind you that extensive pelvic adhesions is a contraindication for HIFU, unless I'm outdated, because this is the classical teaching, because there may be bowel involvement and all that. So how do you make sure that there's no extensive pelvic adhesions or bowel adhesions before even you consider HIFU? And in fact, this is probably one of the reasons we shouldn't start up with doing HIFU, because of the possibility of pelvic adhesions from the presence of endometriosis.
I think the adhesions is a relative contraindication. No? Okay, because HIFU treatment is guided by ultrasound in real time, and you can see the bowel loops during treatment. And now, in all the cases of adenomyosis and endometriosis, you have pelvic adhesions that involve posterior wall of the uterus or fundical uterus. Not always. And you can test, and you can simulation. You can do a simulation, HIFU simulation, and to see and to find out if there are or not there, or there are adhesions in every case. I think it's not a total contraindication. I think you can test, and sometimes the bowel loops are free, and you can treat, and you can see the sonication fill, a triangle during the treatment. If you don't have bowel loops, you can treat. I have some cases with previous laparoscopy and laparotomy surgeries, and no problem, because I can see the bowel during treatment. Of course, there are limitations. Some in obese patients, you cannot see perfectly. Okay, so for me, the most important contraindication for this technique is obesity. Is the most important contraindication, because if you cannot see, you cannot treat. Okay, and addition is relative.
But that you don't have in China.
Yeah, but in Europe and in Spain, it is very common.
And in Louisville, Kentucky, like you heard today from Dr. Bassett. So what is your opinion on this discussion?
Yeah, 的确是
Indeed, obesity in China, especially in southern China, is very rare. So we do not have that people with obesity. Different countries have different situations. It's about the fertility related to the adenomyosis. For fibroid, there is no effective medication. I agree with Professor Cheung. For adenomyosis, we use drugs, medication first. If it's not useful, we go for the next step. Two situations, adenomyoma. So that's a good, if it's localized, we can use HIFU, but if for diffuse ones, we can evaluate whether HIFU is available.
First medication, then HIFU? Yeah.
Then we evaluate whether drug, and then we evaluate. For diffuse ones, there are two ways. One for HIFU, and second, if HIFU is not useful, we can dissect it using open surgery, but that is still the last resort. IVF, about IVF. In China, we do not recommend patients to do IVF first. We would recommend to treat the adenomyosis first.
Okay, Hugo. Class is very satisfactory. So the time is limited.
Pardon?
Yeah, the time is out. Time is out.
We have 5 minutes actually.
Yeah, we have 5 minutes now, so you please. So the last question you propose.
Yeah. When we agree, well, it's different, that we should do something about adenomyosis before saying to the patient, come on, go for IVF or something. What would be the treatment that is fertility preserving? Medication? HIFU? What do you think? Is HIFU a safe treatment for adenomyosis in view of future fertility problems? So, if you are doing surgery on a diffuse adenomyosis, I never did it myself, but I saw some with Professor Tang in Chongqing. I was thinking, God, how will that uterus accept that if the complete uterine wall is coagulated? What about pregnancy, placentation and everything? So, what are you saying?
Okay, this is the last question.
The last question.
Yeah.
To all of you. You're saying nothing.
About the preservation of fertility, three things. Number one, protect the endometrium, protect myometrium, and protect ovarian functions. So the HIFU, it should not damage endometrium. We should protect the wall. We should protect the uterus location. And we should stay away from the uterus. So if these three conditions are met, HIFU comes first.
Last comments?
Yeah. I just want to add one more comment. I'm here. Okay, for the diffused adenomyosis, I think if we do HIFU, we need to care about if for fertility, we need to pretty care about the endometrium, and also how large we need to ablate. And also, after how long we can guide the patient to have a future fertility of have a baby. So I think that we need to wait the uterus to be the normal size or similar to the normal size, because if it's too large, it's not easy to get the conceived. And after that, during the pregnancy, we need to monitor them maybe more carefully than the normal pregnancy woman, because they have done HIFU before. We need to know there is a risk to have the uterine rupture. But we know that for the literature, there's no uterine rupture reported. Yeah, there's no. So but we need to know there's the chance or the risk have the uterus rupture, but we need to monitor them maybe more carefully than the normal pregnancy. Thank you.
Professor. Yeah, I agree with her. It's a good answer. So much. We need to finish. Yeah, we need to finish. Yeah. So because the audience is hungry.
Well, I'm hungry also, but thank you very much that so many people stayed here for this night session here, and I appreciate your contribution. Thank you very much.
Okay.
And next year, we'll discuss this.
Okay, when this section finish, we want all of the audience to have a photo.
Oh.
Photo. Have a photo. This is the last section. 可以照相了，照完相我们就可以吃饭了。